The subcommittee will come to order, and the chair recognizes himself for an opening statement. The legislation before us today will detect, diagnose, and treat chronic diseases and health conditions at earlier stages, improve the quality of life for individuals with disabilities and their families, help ensure Americans in rural communities have access to life-saving care, and provide additional resources to assist in the development of cutting-edge innovation. Last month, we heard from numerous public health experts about how these programs are functioning and whether there are any gaps that need to be addressed in these programs to improve research and health outcomes for patients across the country. The bills before us today will help ensure these critical programs continue. To better help detect, diagnose, and treat Alzheimer's disease, I'm proud we are marking up my bipartisan bill, H.R. 7218, the Building Our Largest Dementia Infrastructure for Alzheimer's Reauthorization Act of 2024, or BOLD Act. The BOLD reauthorization also includes educational resources to help ease these challenges of those caring for loved ones with this vicious disease. These continued investments for caregivers are even more important now that we have treatments to slow the progression of Alzheimer's and will help to ensure patients and their families have more meaningful time together. I would like to thank Representative Tonko for leading this legislation with me, and I urge my colleagues to vote yes on the legislation. We're also considering the Deandra Dixon Include project led by Chair Rogers, which will allow current programs of the National Institutes of Health to continue cutting-edge research on Down syndrome. The Include project will continue to facilitate improved coordination across NIH and build upon research that will improve the quality of life for those individuals living with Down syndrome and can lead to medical knowledge that benefits all patients. To support patients and caregivers, we're marking up legislation led by Representative Kamek, the Charlotte Wood Organ Transplant Discrimination Prevention Act. The legislation would prohibit health care providers and other entities from denying or restricting an individual's access to organ transplant solely on basis of an individual's disability. Over a decade ago, Charlotte Woodward received a heart transplant and has committed her life's work to breaking down unnecessary and discriminatory barriers for individuals with disabilities in need of an organ transplant. Thanks to Charlotte's fierce advocacy, we're one step closer to ensuring individuals and their families don't have to go through what too many have faced when seeking life-saving treatment. Other bills being considered today are designed to improve access to critical emergency services for children and for those living in rural communities. The SIREN Reauthorization Act by David Joyce will continue providing resources for rural emergency health providers, medical providers, to ensure they can maintain their essential services. I know we are still working through some policy considerations, but I'm confident we can come to a resolution before the program expires in September. Next is the Bipartisan Emergency Medical Services for Children Reauthorization Act. It is often said that children are not just little adults. This bill will continue programming designed to ensure EMS providers have the proper training and equipment to care for children in emergency situations. Finally, we're marking up two pieces of legislation that we heard about in the fall. The Seniors Access to Critical Medications Act, led by Representative Harshberger, and Kidney Patient Act, led by Mr. Carter. The Seniors Access to Critical Medications Act would allow cancer patients to continue receiving the necessary care in the safest, most convenient way possible. I look forward to working with my committee colleagues to advance these two bills out of subcommittee today and addressing any additional outstanding issues before full committee. Thank you to all my colleagues who worked hard to get the legislation before us today and for their leadership on these policies. I yield back and I represent the Ranking Member Eshoo for 5 minutes for her opening statement.
Thank you, Mr. Chairman, and good morning, colleagues. Part of our essential work as members is making sure that important public health programs nearing their expiration are continued, improved, and in some cases, expanded. I'm so pleased that our subcommittee is beginning that work today by marking up 19 bills to authorize public health programs that support and improve the health and the well-being of adults as well as children. We'll consider legislation to support patients in the fight against cancer. The Screens Act for Cancer Act, introduced by Representatives Morell and Fitzpatrick, reauthorizes through fiscal year 2028 the National Breast and Cervical Cancer Early Detection Program, which has provided life-saving cancer screening and screening services to low-income, uninsured, and underinsured women in all 50 states. The legislation addresses the alarming trend of young adults, especially women, being diagnosed with late-stage cancer. Current cancer screening guidelines have not kept pace with these trends, and the bill will help move the needle on this. We'll also consider bills to enhance medical research at the NIH and ensure that all Americans are included in research, such as the Deandra Dixon Include Project Act, introduced by Chair Rogers, Representatives DeGette and DeLauro. The legislation authorizes the Include Project at the NIH for 5 years and ensures individuals with Down syndrome live healthy, long lives. The individuals with Down syndrome are highly predisposed to diseases like Alzheimer's, yet are included in very few clinical trials and research programs. We'll also consider 2 bills to improve medication adherence and access for patients diagnosed with kidney disease or fighting cancer. I hope we can come to a bipartisan agreement on these bills to put patients first. No matter where one lives in our country, the critical programs at CDC and HRSA will make important differences in the lives of millions of Americans. And I stand ready to work with all of my colleagues to ensure that these programs are reauthorized. So thank you, Mr. Chairman, and I yield back.
Thank you. The gentlelady yields back. The chair recognizes the chair of the full committee, Chair Rogers, for 5 minutes for her opening statement.
Good morning. I'm glad we're here today moving so many important pieces of legislation that will strengthen the health and well-being of the American people, almost all of which have broad bipartisan support. This committee continues to prioritize examining programs set to expire, making changes if necessary, and reauthorizing those programs in advance of their expiration. Many of the bills before us today reauthorize important programs that are due to expire September 30th. And I'm hopeful we can renew them in advance of that deadline through regular order. This committee has a rich history of plowing the hard ground necessary to legislate, including our bipartisan work to ensure we are moving forward timely reauthorizations, as well as new efforts like the Lower Cost, More Transparency Act. I look forward to seeing all of these important initiatives be signed into law. I'm especially excited that we're considering my legislation to authorize the Include project at the National Institutes of Health, which signals to appropriators that it should continue and receive robust support. My mission of improving the lives of individuals with disabilities is no secret and is deeply personal. At the time Include was established, Down syndrome was among the least studied and funded genetic conditions at NIH, despite it being one of the most common chromosome abnormalities. And now Include has funded over 200 awards and helps coordinate Down syndrome research and resources across 20 NIH institutes and centers. One of the most incredible things about the Include project is its potential, not just to benefit those individuals with Down syndrome, but for all patients that suffer from cancer, Alzheimer's, and many other conditions that occur often in those with Down syndrome. I'm proud of the work of this bill and the Include project and what it has already accomplished. And I ask for your support in helping everyone with Down syndrome and their families and many more live lives to their fullest potential. My legislation, as drafted, increases the authorized level over what is currently appropriated. I will continue to explore all options to ensure we're authorizing this program in a fiscally responsible manner. That said, I'd like to move forward today with a voice vote as we continue to work on how best to address the important funding for this program. Additionally, we'll be considering Rep. Harshberger's bipartisan Seniors Access to Critical Medications Act, which has been co-sponsored by a number of members from both sides of the aisle on this committee. I know that there's more work to be done regarding technical assistance and offsetting any cost associated with the bill, but I'm hopeful that we'll be able to resolve those issues before consideration by the full committee. We're also considering Rep. Carter's bipartisan Kidney Patient Act. As we discuss this bill, I would note that Congress has delayed putting these drugs into the ESRD bundle in previous laws with bipartisan support. And just last week, a version of this policy passed out of Ways and Means Committee with only one no vote. I hope my colleagues support the bill today and if necessary, we can continue working on technical issues before the full committee markup. I won't take the time to discuss in detail all of the other important bills before the subcommittee today on issues such as Alzheimer's, heart disease research, emergency care, but this markup is an example of how this committee continues to lead the way in showing how to get work done for the American people. I'm proud of what we continue to accomplish when we work together, and I look forward to furthering this important work with all of you. I yield back.
Thank you. The chair yields back. The chair will now recognize the ranking member of the full committee, Ranking Member Pallone, for 5 minutes for an opening statement.
Thank you, Mr. Chairman. Today, this subcommittee will reaffirm its commitment to supporting our nation's public health infrastructure by considering bipartisan legislation to strengthen or extend important public health programs. And I'm pleased that we'll be considering H.R. 6829, the HEARTS Act, which I introduced in December. This bill was inspired by 2 New Jersey families who each tragically lost a child to sudden cardiac arrest during high school sporting events. Sadly, more than 2,000 children and adolescents die this way every single year, and the bill aims to prevent future deaths from cardiac arrest by preparing schools to respond to cardiac emergencies when they occur. It directs the Secretary of Health and Human Services to develop guidelines on the placement of automated external defibrillators, or AEDs, in schools, and to provide resources to help schools create and implement a cardiac emergency response plan. The HEARTS Act will raise awareness about the causes of sudden cardiac arrest and ensure schools are more prepared to deal with cardiac emergencies so we can save lives. We'll also consider other legislation to extend key public health priorities. 3 bills will support the estimated 6.7 million Americans over the age of 65 who are living with Alzheimer's disease. 2 bills will support the continued mission of the National Alzheimer's Project to coordinate federal planning and funding to promote healthy aging. And a 3rd bill reauthorizes the BOLD infrastructure program to help public health departments implement effective Alzheimer's interventions. We also have a bill to reauthorize the Dr. Lorna Breen Healthcare Provider Protection Act, which promotes strategies to reduce and prevent suicide, burnout, and substance use disorders among our healthcare providers. This reauthorization is essential considering that the Centers for Disease Control and Prevention warns of a mental health crisis among health workers who routinely face harassment, burnout, and poor mental health related to their jobs. I strongly support this bill, which reauthorizes the program for 5 years. We have other bills to reauthorize public health programs that strengthen rural emergency medical services, fund poison control centers, improve research into Down syndrome and stillbirths, and provide screening and support to patients with traumatic brain injury and women with life-saving breast and cervical cancer screenings. These public health reauthorization bills should all be advanced to the full committee. And while I strongly endorse many of the bills being considered today, there are a couple of bills I can't support. I have significant concerns with H.R. 5074, as I believe the bill would further impede seniors' access to necessary medication and raise their health care costs by further delaying the inclusion of oral-only drugs to treat end-stage renal disease into Medicare Part B. These drugs are crucial for over 60% of patients on dialysis who rely on them for necessary care. Right now, about 20% of Medicare patients on dialysis do not have Part D coverage. Congress has acted to delay inclusion of these drugs into the ESRD bundle for a decade at the expense of some seniors without access to prescription drug coverage. And I do not agree with supporters of this legislation that the system is not ready for the transition. It's time for the delays to stop. I'm also disappointed we could not find a bipartisan path forward on H.R. 5526. Congress enacted the Physician Self-Referral Law, also known as the Stark Law, to ensure that physician financial considerations do not influence patient care. Under the Stark Law, physicians are prohibited from making referrals to entities where the physician has a financial stake. It is critical in ensuring that financial arrangements do not distort physician decision-making or raise healthcare costs. And I share the concerns of the HHS Office of Inspector General and law enforcement agencies that by further broadening the exemptions under the Stark Act, the bill would undermine their ability to protect the integrity of the Medicare program. I also understand the Congressional Budget Office estimates that this bill has significant scoring implications, partly due to increased overutilization. Patients deserve access to treatment that is medically appropriate and necessary for them, and I can't support a bill that would undermine patient safety and raise health care costs for seniors. And with that, Mr. Chairman, I yield back the balance of my time. Thank you.
Thank you. The ranking member yields back. That concludes opening statements, and we'll now move to the markup, and the chair calls up H.R. 619 and asks the clerk to report.
H.R. 619, a bill to extend the National Alzheimer's Project.
Without objection, the first reading of the bill is dispensed with, and the bill will be open for amendment at any point. So ordered. Does anyone seek recognition on the bill? Does the gentlelady want to offer an amendment? Any recognition on the bill? Any bipartisan amendments? The gentlelady from Minnesota is recognized.
Thank you, Mr. Chairman. I have an amendment at the desk.
The clerk will report the amendment.
Amendment in the nature of a substitute to H.R. 619, offered by Ms. Craig.
Without objection, the reading of the amendment is dispensed with, and the gentlelady is recognized for 5 minutes in support of the amendment.
Mr. Chairman, I move to strike the last word and speak in favor of my amendment in
Gentlelady is
nature.
recognized.
Excellent. I'd like to start by thanking my colleague from New York, Representative Tonko, for introducing this reauthorization and for his tireless advocacy on behalf of people living with Alzheimer's disease. Congress first passed the National Alzheimer's Project Act, or NAPA, back in 2011 to address the rapid growth in Alzheimer's and other dementia diagnoses. NAPA created the country's first national strategic plan around Alzheimer's disease and set an ambitious goal of preventing and effectively treating Alzheimer's by 2025. While tremendous progress has been made since 2011, the search for a cure continues. I'd like to take a moment to share the story of a constituent of mine, Ralph Jewell. Ralph was a resident of Mendota Heights, Minnesota. He first began to experience symptoms shortly after he retired in 2006. His wife, Kay, began to notice that Ralph, an avid outdoorsman with a keen sense of direction, was getting lost on the way home from running errands. Ralph became increasingly forgetful and, after consulting with a physician, was subsequently misdiagnosed with depression. It was only after Kay's fierce advocacy on her husband's behalf that he received a diagnosis of Alzheimer's disease a few months later. Ralph lived another 9 years before passing away from the disease in 2016. Ralph and Kay's story is just one example of why this legislation is so critical. This reauthorization, as amended, would extend NAPA another decade through 2035 to continue the critical work of coordinating and finding efforts toward new Alzheimer's breakthrough treatments. The NAPA Reauthorization Act renews this committee's commitment to the nearly 7 million Americans living with Alzheimer's dementia, like Ralph. Thank you again to Congressman Tonko and for your leadership, Mr. Chairman, on this issue. And with that, I yield back.
The gentlelady yields back. Is anyone looking for recognition on the amendment? The gentleman from Georgia, Mr. Carter, is recognized to speak on the
Mr.
amendment.
Chairman, move to strike the last word.
Gentleman's recognized.
Mr. Chairman, I'm proud to join my colleagues in supporting the National Alzheimer's Project Reauthorization Act. As my colleagues have pointed out, the legislation reauthorizes the National Alzheimer's Project Act through 2035 to provide a roadmap for federal efforts in responding to Alzheimer's and dementia. Alzheimer's is a cruel disease that attacks a person's quality of life. As a pharmacist, I saw firsthand the impact Alzheimer's and other forms of dementia have on patients, families, caregivers, and society overall. People living with Alzheimer's lose their memories, their independence, their relationships, and ultimately their lives. Beyond the patients, caregivers, and loved ones endure immense emotional and financial difficulties. With 6.7 million Americans suffering with Alzheimer's, there's a crucial need for federal resources to prevent, treat, and ultimately find a cure for this devastating disease. I'm optimistic that the tide can be reversed. We now have FDA-approved treatments to slow disease progression, and I think we can all agree that we look forward to the day the world has its first survivor of Alzheimer's. While great progress has been made and new therapies are advancing to help patients and caregivers, we cannot let up the fight. In honor of those who have battled and continue to battle this disease, let's continue to work together to raise awareness and pass this bill. Thank you, Mr. Chairman, and I yield back the remainder of my time.
Gentleman yields back. Anyone else seeking recognition on the amendment? Seeing none, if there's no further discussion, the vote occurs on the amendment offered by the gentlelady from Minnesota. All those in favor shall signify by saying aye.
Aye.
All those as no. The ayes have it, and the amendment is agreed to. Is there any further discussion on the amendment? Seeing no other discussion, the question now occurs on forward at H.R. 619 as amended to the full committee. All those in favor will say aye. All those opposed, actually, a roll call has been requested, so the clerk will call the roll.
Burgess. Burgess votes aye. Latta. Latta votes aye. Griffith. Griffith votes aye. Bilirakis. Bilirakis votes aye. Bouchon. Bouchon votes aye. Hudson. Carter. Carter votes aye. Dunn. Dunn votes aye. Pence. Pence votes aye. Crenshaw. Joyce. Harshbarger. Harshbarger votes aye. Miller Meeks. Miller Meeks votes aye. Obernolte. Obernolte votes aye. Guthrie.
Aye.
Guthrie votes aye. Eshue.
Aye.
Eshue votes aye. Sarbanes. Sarbanes votes aye. Cardenas. Ruiz. Ruiz votes aye. Dingell. Dingell votes aye. Custer. Custer votes aye. Kelly. Barragan. Blunt Rochester. Craig. Craig votes aye. Schreier. Schreier votes aye. Trahan. Pallone. Pallone votes aye. Rogers. Rogers votes aye.
Sometime this summer. The clerk will report. Or is anybody seeking recognition to Ms. Kelly? Has Ms. Kelly reported?
Ms. Kelly's not recorded. Kelly votes aye.
Ms. Barragan?
Barragan is not recorded. Barragan votes aye.
Anyone else seeking recognition for enter the roll call? Seeing no members seeking to answer the roll call, the clerk will report.
Chair Guthrie, on that vote, there were 23 ayes and 0 noes.
With 23 ayes and 0 noes, how's the gentleman from Pennsylvania recorded?
Mr. Joyce is not recorded. Joyce votes aye.
Since I hadn't called the vote. Yeah, how's the gentleman from California recorded?
Mr. Cardenas votes aye.
Anyone else seeking recognition? The clerk will report.
Chair Guthrie, on that vote, there were 25 ayes and 0 noes.
How's the lady from Massachusetts recorded?
Mr. Hand votes aye.
The clerk will report.
Chair Guthrie, on that vote, there were 26 ayes and 0 noes.
I'm about to call the vote. All right. With 26 ayes and 0 nays, the bill is agreed to. The chair calls up H.R. 620 and asks the clerk to report.
H.R. 620, a bill to require an annual budget estimate for the initiatives of the National Institutes of Health pursuant to reports and recommendations made under National Alzheimer's Project Act.
Without objection, the first reading of the bill is dispensed with, and the bill will be open for amendment at any point so ordered. Does anyone seek recognition on the bill? Gentleman from Florida, you're recognized to speak on the bill.
Thank you, Mr. Chairman. I move to strike the last word.
Gentleman is recognized.
Thank you, Mr. Chairman. I wanted to speak briefly to express my strong support for all 3 bills we have on today's agenda that reauthorize critical Alzheimer's care and research programs on the federal level. Sadly, Alzheimer's is the 7th leading cause of death in the U.S. Today, in my home state of Florida, the number of cases is expected to grow by over 24%, with an estimated 720,000 individuals living with Alzheimer's. Without a cure, the impact of Alzheimer's will continue to rise, and the number in Florida and across the country will escalate as a result of an aging population. This disease does not discriminate, and I'm sure we all have someone or know someone whose family has been affected by Alzheimer's. For me, it's very personal, as my mom has been afflicted by this horrific disease. We must continue our all-of-government approach in the fight against Alzheimer's, and I'm grateful our committee is focusing Thank you, Mr. Chairman, for all you do as well on this issue. But we're focusing on efforts, and these good bills we're moving forward to find a cure. Over a decade ago, we passed the National Alzheimer's Project Act to establish a federal strategic plan to address Alzheimer's and coordinate our federal programs into finding treatments and supporting caregivers to advance care, and we need it, advanced care for Alzheimer's patients. Since then, we have made a tremendous amount of progress and have channeled these efforts into new research and development in the private sector, into new treatment options. And we now have drugs on the market that target early onset Alzheimer's to slow the progression of this disease. Progress is being made. H.R. 619, the NAPA Reauthorization Act, which we just voted on, this is a strategic plan. It updates the current advisory council to include additional stakeholders, add new goals to reduce risk factors, and regularly update Congress on its efforts. Furthermore, H.R. 620, the Alzheimer's Accountability and Investment Act, will extend NIH's ability to submit annual Alzheimer's research budget proposal to the Congress so we can fully pursue scientific and biomedical research and opportunities nationwide. Lastly, H.R. 7218, the Bold Infrastructure for Alzheimer's Act, reauthorizes critical public infrastructure programs at the state and federal levels to ensure we remain committed to supporting families and caregivers and improving brain health for patients across the country. I'm grateful again for Chair Guthrie's efforts to reauthorize the Bold Infrastructure Program and was proud to co-sponsor H.R. 7218. I also want to recognize the leadership of my good friend Chris Smith and my good friend Paul Tonko. We work on many issues, including Parkinson's, together. And I want to thank them for their tireless efforts on these particular bills. I ask that my colleagues support the 3 Alzheimer's focused bills on the agenda today. And I yield back, Mr. Chairman. Thank you.
Gentleman yields back. Anyone seeking recognition to speak on the bill? Seeing no further members seeking recognition on the bill, does anyone have are there any bipartisan amendments? Any partisan amendments? Seeing none, the question now occurs on forwarding H.R. 620 to the full committee, and a roll call has been requested. The clerk will call the roll.
Burgess. Burgess votes aye. Latta. Latta votes aye. Griffith. Griffith votes aye. Bilirakis. Bilirakis votes aye. Bouchon. Bouchon votes aye. Hudson. Carter. Carter votes aye. Dunn. Dunn votes aye. Pence. Pence votes aye. Crenshaw. Joyce. Joyce votes aye. Harshbarger. Harshbarger votes aye. Miller Meeks. Miller Meeks votes aye. Obernolte. Obernolte votes aye. Guthrie.
Aye.
Guthrie votes aye. Eshoo. Eshoo votes aye. Sarbanes. Sarbanes votes aye. Cardenas. Cardenas votes aye. Ruiz. Ruiz votes aye. Dingell. Dingell votes aye. Custer. Custer votes aye. Kelly. Kelly votes aye. Barragan. Barragan votes aye. Blunt Rochester. Craig. Schreier. Schreier votes aye. Trahan. Trahan votes aye. Pallone. Pallone votes aye. Rogers. Rogers votes aye.
Anyone else seeking recognition to call the roll?
As Craig is not recorded. Craig votes aye.
Anyone else seeking recognition for enter the roll? Seeing none, the clerk will report.
Chair Guthrie, on that vote, there were 26 ayes and 0 noes.
With 26 ayes and 0 noes, the bill is agreed to. The chair will call up, notes here. The chair will call up H.R. 7218 and ask the clerk to report.
H.R. 7218, a bill to amend Title III of the Public Health Service Act to extend the program for promotion of public health knowledge and awareness of Alzheimer's disease and related dementias and for other purposes.
Without objection, the first reading of the bill is dispensed with, and the bill will be open for for amendment at any time. So order, and the chair will recognize, I would recognize myself to speak on the bill. Speaking in support of my legislation, the building our largest dementia infrastructure for Alzheimer's Reauthorization Act, or BOLD Act. This legislation will reauthorize programs to continue research into Alzheimer's disease, invest in caregiver support service, including more hands-on educational resources for those caregiving for their loved ones, and help support local efforts to detect and diagnose Alzheimer's disease sooner, especially for those in rural and medically underserved communities. According to the Alzheimer's Association, nearly 7 million Americans are currently living with Alzheimer's disease, and the number is expected to increase. Dementia is also one of the costliest conditions in society. The price of health and long-term care is estimated to be $345 billion, with around two-thirds of those individuals being Medicare or Medicaid patients. This is in addition to the 18 billion hours of unpaid help and the 11.5 million caregivers provide each year, valued at nearly $340 billion. The emotional and financial toll the disease takes on family caregivers cannot be understated. About 40% of these caregivers estimated to make less than $50,000 a year. Simply put, more work is needed to support patients and their families combating this vicious disease. That is why I'm glad we are considering the BOLD Act today to accelerate the cutting-edge research programs, provide continued support for our families and caregivers, and advancing resources to help detect and diagnose Alzheimer's disease as quickly as possible. The more we know about the disease, the sooner we'll be able to appropriately treat it, giving patients more precious time with their loved ones and easing the significant caregiver burdens have associated with Alzheimer's and related dementias. Thanks to the innovative work being done by our private sector partners, this research and resources are especially necessary today at the precipice of a true transformation in how we diagnose and treat the disease. I look forward to continued progress in ushering in a new era of innovation. I want to thank Representative Tonko for his joining me in reauthorizing these important programs, and I will yield back. Does anyone else seek recognition to speak on the bill?
Mr. Chairman.
The gentlelady from California seeks recognition.
Yes, I move to strike the last word.
You're recognized for 5 minutes.
Thank you, Mr. Chairman. I want to thank you for this legislation and our colleagues for working on Alzheimer's issues on a bipartisan basis, because as we all know, Alzheimer's is not a Democrat issue or Republican issue. It is an issue that affects all Americans. And this particular bill, which will reauthorize the BOLD Act and empower public health departments to continue to improve brain health and support caregivers in their communities, is something that's going to be super helpful. As somebody who has a mother who has Alzheimer's, and as somebody who is also a caregiver, which often requires me to fly back and forth more often than not and miss very important trips and meetings and events, it does take a toll, and I can attest to that myself. So I am proud to support this bill and efforts that we continue to support caregivers across this country. Over 160,000 residents in Los Angeles County live with Alzheimer's disease, and this number is expected to increase by 150% by the year 2040. In 2023, the CDC announced 43 award recipients, the most in a single year since BOLD was signed into law, which included LA County. With these funds, the county was able to launch LA Bold, an initiative that brought together stakeholders across multiple industries to address dementia awareness and care. This includes a goal to improve the local infrastructure that supports unpaid family caregivers, which is critical to address the unique needs of our diverse communities. I strongly support this bipartisan legislation. I thank all our colleagues for continuing to work on this important issue, and I yield back.
Thank you for your comments. I know you're personally going through this. Is
Mr. Chairman.
Gentleman from Ohio, what purpose you seek recognition?
Strike the last word, Mr.
Gentleman's
Chairman.
recognized.
Well, thank you very much, Mr. Chairman. Unfortunately, I've seen firsthand how devastating Alzheimer's and other dementias affect those who are diagnosed with this horrible disease, and how it also affects their families. Lives drastically change as husbands, wives, brothers, sisters, or children become caregivers for their loved ones. In Ohio, over 220,000 individuals suffer from Alzheimer's, and it is estimated that about 1 in 3 seniors die with Alzheimer's or another dementia. Tragically, 6.7 million Americans today suffer from this disease, with an estimated 12.7 million by 2050. It is long past due that we offer hope for those who are suffering. That is why I'd like to commend the leadership of our subcommittee chair, and the gentleman from New York's 20th District for leading the reauthorization of the BOLD Infrastructure for Alzheimer's Reauthorization Act of 2024. We need better earlier detection, assistance for those affected, a treatment for those diagnosed, and most importantly, a cure. I look forward to supporting this crucial piece of legislation and encourage my colleagues to do so. And thank you, Mr. Chairman. I yield back the balance of my time.
Thank you, and thank you for sharing your stories as well. The gentleman yields back. Is there any further discussion on the bill? Seeing none, are there any bipartisan amendments? Seeing none, are there any other amendments? Seeing none, the question now occurs on forwarding H.R. 7218 to the full committee, and a roll call is requested. The clerk will call the roll.
Burgess. Burgess votes aye. Latta. Latta votes aye. Griffith. Griffith votes aye. Bilirakis. Bilirakis votes aye. Bouchon. Bouchon votes aye. Hudson. Carter. Dunn. Dunn votes aye. Pence. Pence votes aye. Crenshaw. Joyce. Joyce votes aye. Harshbarger. Harshbarger votes aye. Miller Meeks. Miller Meeks votes aye. Obernolte. Obernolte votes aye. Guthrie.
Aye.
Guthrie votes aye. Eschew.
Aye.
Eschew votes aye. Sarbanes. Sarbanes votes aye. Cardenas. Cardenas votes aye. Ruiz. Ruiz votes aye. Dingell. Dingell votes aye. Custer. Custer votes aye. Kelly. Kelly votes aye. Badagan. Badagan votes aye. Blunt Rochester. Craig. Craig votes aye. Schreier. Schreier votes aye. Trahan. Trahan votes aye. Pallone. Pallone votes aye. Rogers. Rogers votes aye.
Anyone seeking to answer the roll? Seeing none, the clerk will report.
Chair Guthrie, on that vote, there were 25 ayes and 0 noes.
With 25 ayes and 0 noes, the bill is agreed to. The chair will now call up H.R. 4581 and ask the clerk to report.
H.R. 4581, a bill to amend Title V of the Social Security Act to support stillbirth prevention and research, and for other purposes.
Without objection, the first reading of the bill is dispensed with, and the bill will be open for amendment at any point so ordered. Does anyone seek recognition on the bill? Are there any bipartisan amendments to the bill? Does the gentleman? I believe there's an Ains to the bill. You have an amendment? The gentleman from Texas is recognized.
Thank you, Mr. Chairman. This is an amendment nature of substitute to H.R. 4581.
I'll have the clerk report the amendment.
Amendment in the nature of a substitute to H.R. 4581, offered by Mr. Burgess.
Without objection, the reading of the amendment is dispensed with, and the gentleman from Texas is recognized for 5 minutes.
Thank you, Mr. Chairman. This amendment will make a technical change by striking the finding sections of the bill. H.R. 4581, the Maternal and Child Health Stillbirth Prevention Act, would expand the scope of the Maternal and Child Health Services Block Grant to include stillbirth prevention, research, and activities, allowing for a more comprehensive approach to maternal and child health. Stillbirth does represent a significant aspect of reproductive health, and it must be addressed to ensure the well-being of both mothers and babies. Preventive measures, including research and activities to prevent stillbirths in the grant program, allows for the implementation of measures aimed at reducing the incidence of stillbirths. This is a proactive approach and can help identify risk factors, develop interventions, and promote healthy pregnancies, ultimately leading to fewer stillbirths, better outcomes for families. And I urge adoption of the amendments to you back.
Gentleman yields back. Are there any discussion of the amendment? Seeing none. If there's no further discussion on the amendment, the vote occurs on the amendment. All those in favor shall signify by saying aye. All those opposed, nay. The ayes have it, and the amendment is agreed to. Are there any other amendments to the bill? Recognition to speak on the bill? Gentlelady from Illinois is recognized. Gentlelady is recognized.
Stillbirths affect 1 in 170 pregnancies, with over 20,000 babies born still every year in the U.S. Nevertheless, what's more disheartening is that studies show that nearly a fourth of these stillbirths are preventable, and the majority occur in what would otherwise be considered low-risk pregnancies. Furthermore, certain groups, such as Black women, Medicaid recipients, and those living in rural areas, share a disproportionate burden of these lives lost, highlighting the urgent need for targeted interventions and equitable access to care. We've seen other industrialized nations, such as the UK and Australia, invest in focused stillbirth education and prevention efforts, which significantly decreased their rate in just a few years. We cannot sit complacently. We must act to better understand the cause of preterm birth, what is causing this shocking increase, and what we can do to prevent preterm birth to allow our moms and babies the best start in life possible. These inequities in the maternal care system have a real-world impact, where maternity and newborn care account for a large category of hospital payouts for most commercial insurers and state Medicaid programs. With Medicaid as a primary payer for 42% of births in the U.S., the federal government has a major responsibility for ensuring the quality and value of maternal newborn care. I am proud to be a co-sponsor of Rep. Henson's bill, H.R. 4581, the Maternal and Child Health Stillbirth Prevention Act, which calls for further evidence-based programs to reduce the incidence of stillbirth. I encourage my colleagues to support this bill and also the SHINE bill to ensure no mother has to go through these horrendous events of having their baby born still. Additionally, I ask for unanimous consent to have a letter from the March of Dimes be submitted into record in support of H.R. 5012, the Shine for Autumn Act, and H.R. 4581, the Maternal and Child Health Stillbirth Prevention Act. And thank you, and I yield back.
Gentlelady yields back. Any further discussion on the amendment? Then we've already adopted. So the question now, being no other people are seeking recognition, the question now occurs on forwarding H.R. 4581 as amended to the full committee, and a roll call has been requested. The clerk will call the roll.
Burgess. Burgess votes aye. Latta. Latta votes aye. Griffith. Griffith votes aye. Bilirakis. Bilirakis votes aye. Bouchon. Bouchon votes aye. Hudson. Carter. Dunn. Pence. Pence votes aye. Crenshaw. Joyce. Joyce votes aye. Harshbarger. Harshbarger votes aye. Miller Meeks. Miller Meeks votes aye. Obernolte. Obernolte votes aye. Guthrie. Guthrie votes aye. Eshue. Eshue votes aye. Sarbanes. Sarbanes votes aye. Cardenas. Cardenas votes aye. Ruiz. Ruiz votes aye. Dingell. Dingell votes aye. Custer. Custer votes aye. Kelly. Kelly votes aye. Badagan. Blunt Rochester. Badagan votes aye. Craig. Craig votes aye. Schreier. Schreier votes aye. Trahan. Trahan votes aye. Pallone. Pallone votes aye. Rogers. Rogers votes aye.
I know you called the roll twice. Someone, she properly. How's the delay from California recorded?
Ms. Badagan is recorded as aye.
Aye. Okay, so I'll make sure you got that right. Got that. Gentleman from Florida, how's he recorded?
Mr. Dunn is not recorded. Dunn votes aye.
Anyone else seeking the roll call? Seeing none, the clerk will report.
Chair Guthrie, on that vote, there are 25 ayes and 0 noes.
25 ayes and 0 noes. The bill is agreed to. The chair calls up H.R. 4646 and ask the clerk to report.
H.R. 4646, a bill to reauthorize the Rural Emergency Medical Service Training and Equipment Assistance Program and for other purposes.
Without objection, the first reading of the bill is dispensed with, and the bill will be open for amendment at any point so ordered. Does anyone seek recognition on the bill? The gentlelady from Iowa is recognized for 5 minutes to speak on the bill. Were there any, so no other speaking on the bill, so the gentlelady has an amendment at the desk? The clerk will report the amendment.
Amendment in the nature of a substitute to H.R. 4646, offered by Ms. Miller Meeks.
Without objection, the reading of the amendment is dispensed with, and the gentlelady is recognized for 5 minutes in support of her amendment.
Thank you, Mr. Chairman. I speak in support of my amendment in the nature of a substitute which makes technical corrections to H.R. 4646, the Supporting and Improving Rural EMS Needs, or SIREN Act. With medical costs rapidly increasing, many EMS providers are abandoning rural areas and are instead only offering services in urban or suburban areas, further exacerbating access challenges already felt by rural Americans. According to the National Rural Health Association, roughly 53% of rural EMS agencies are staffed by volunteers, compared with just 14% in urban areas. This legislation became law in 2018 and helps support rural EMS departments through competitive grants. Recipients can use funds for various EMS and fire-related services, such as PPE, power stretchers, and even ambulances. This critical legislation is necessary to alleviate the burden on rural healthcare workers, and I urge my colleagues to support my ANS and the underlying bill. Thank you, Mr. Chairman, and I yield back the balance of my time.
Gentlelady yields back. Any further discussion of the amendment? The gentleman from California is recognized on the amendment.
Yes, I first want to thank Dr. Miller Meeks for introducing this bill. This is very important for me as an emergency medicine physician that has practiced pre-hospital care alongside paramedics and firemen and women. There are ambulance deserts throughout our country, especially in rural America. In my district, sometimes it takes up to an hour to get to certain parts of my district. And we know in emergency medicine that time is life. Brain cells, cardiac cells have a short window of time to be revascularized during heart attacks or strokes that can make the difference between permanent disability or even life and death. So making sure that every American in our country has access to emergency care immediately when they need it is vital and very important for all of us, and that's why I support the underlying bill, as well as these technical amendments offered by Congresswoman Miller Meeks. You want my time? You want some time? And I yield my time to Congresswoman Dingell.
Thank you. As co-chair of the Emergency Medical Services Caucus, or EMS Caucus, supporting our nation's EMS workers remains one of my top priorities. That's why I am proud to lead the SIREN Reauthorization Act with Representative David Joyce. And I appreciate this bill. I want to thank the chairman for including it as part of today's subcommittee markup. Housed within the Substance Abuse and Mental Health Services Administration, SIREN grants help improve emergency medical services in rural communities. These grants help rural EMS agencies better train and recruit staff, acquire new equipment, and develop new ways to educate EMS personnel. EMS workers are the first to arrive at the scene of an emergency and have to quickly evaluate the situation and determine the best course of action for a patient in their most vulnerable and critical state. Across America's small towns, rural EMS agencies in particular are the critical lifeline to the healthcare system. So it's imperative that they have the federal support they need to carry out this very important mission. With this legislation to reauthorize the SIREN program through 2029, we can expand upon our efforts to better assist these hometown heroes, and they are our hometown heroes. I urge all of my colleagues to support this bill, and I guess I'll yield back to you.
And anybody else want my 2 minutes? Okay, then I yield back.
The gentleman yields back. Dr. Reese yields back. Any further discussion on the amendment? Seeing none,
That was perfect. Thanks.
if there are no further discussion, the vote occurs on the amendment. All those in favor shall signify by saying aye. Aye. All those opposed, nay. The ayes have it, and the amendment is agreed to. Are there any other amendments to the bill? Seeing none, the question now occurs on forwarding H.R. 4646 as amended to the full committee. All those in favor, well, the roll call has been requested, so the clerk will call the roll.
Burgess. Burgess votes aye. Latta. Latta votes aye. Griffith. Bilirakis. Bilirakis votes aye. Bouchon. Bouchon votes aye. Hudson. Carter. Dunn. Dunn votes aye. Pence. Crenshaw. Joyce. Joyce votes aye. Harshbarger. Harshbarger votes aye. Miller Meeks. Miller Meeks votes aye. Obernolte. Obernolte votes aye. Guthrie.
Aye.
Guthrie votes aye. Eschew.
Aye.
Eschew votes aye. Sarbanes. Sarbanes votes aye. Cardenas. Cardenas votes aye. Ruiz. Ruiz votes aye. Dingell. Dingell votes aye. Custer. Custer votes aye. Kelly. Kelly votes aye. Badagan. Badagan votes aye. Blunt Rochester. Craig. Schreier. Schreier votes aye. Trahan. Trahan votes aye. Pallone. Pallone votes aye. Rogers. Rogers votes aye.
Anyone seeking to be, how is Mr. Pence recording?
Mr. Pence is not recorded. Pence votes aye. Craig is not recorded. Craig votes aye.
Any further people for the roll call? Seeing none, the clerk will call the roll. The clerk will report, I'm sorry.
Chair Guthrie, on that vote, there were 24 ayes and 0 noes.
24 ayes and 0 noes, the bill is agreed to. The chair calls up H.R. 6160 and asks the clerk to report.
H.R. 6160, a bill to amend the Public Health Service Act to reauthorize a lifespan respite care program.
Without objection, the first reading of the bill is dispensed with, and the bill will be open for amendment at any time, at any point so ordered. Does anyone seek recognition on the bill? You have an amendment you want to seek? Does anyone, no recognition on the bill? The gentleman from California is recognized for his amendment.
Thank you, Mr. Chairman. I have an amendment in the nature of a substitute at the desk.
Clerk will report.
H 6160 SCR Ains 01.
The clerk will report the amendment.
Amendment in the nature of a substitute to H.R. 6160, offered by Mr. Cardenas.
Without objection, the reading of the amendment is dispensed with, and the gentleman from California is recognized for 5 minutes in support of his amendment.
Thank you, Mr. Chairman. This Ains makes small technical changes to the underlying bill, and I encourage my colleagues to support it. When we discussed this bill in a hearing last month, I mentioned the essential role that uncompensated caregivers play in our care systems. When a loved one gets sick or struggles with a disability, their care often falls on that person's community. As I said before, whether it is a friend, a family member, or another uncompensated caregiver, providing quality support is a 24/7 job. That's why I'm proud to co-lead with the bill, the Lifespan Respite Care Reauthorization Act, along with Rep. Molinaro. This bipartisan bill supports the health and well-being of family caregivers by reauthorizing the Lifespan Respite Care Program. There are more than 53 million family caregivers in the United States. While it can be very rewarding, it also can be emotionally and physically challenging. Respite care, which is the opportunity to entrust care of loved ones to someone else temporarily, is one of the most frequently reported unmet needs of caregivers. By providing temporary relief to caregivers, respite care helps to reduce the mental stress and physical health issues that caregivers might experience. In doing so, respite care also decreases the need for professional long-term care, which allows individuals who require care to remain at home. This is a good program that provides very real necessary help to those who are often selflessly caring for their loved ones, day in and day out. I urge my colleagues to support the Ains and the underlying bill. And with that, I yield back, Mr. Chairman.
Gentleman yields back. Any discussion on the amendment? Seeing no further discussion on the amendment, the question, if there's no further discussion, the vote occurs on the amendment. All those in favor shall signify by saying aye. Aye. All those opposed, nay. In the opinion of the chair, the ayes have it, and the amendment is agreed to. Are there any other amendments? Seeing none, the question now occurs on forwarding H.R. 6160 as amended to the full committee, and a roll call has been requested, and the clerk will call the roll.
Burgess. Burgess votes aye. Latta. Latta votes aye. Griffith. Bilirakis. Bilirakis votes aye. Bouchon. Bouchon votes aye. Hudson. Carter. Carter votes aye. Dunn. Dunn votes aye. Pence. Crenshaw. Crenshaw votes aye. Joyce. Joyce votes aye. Harshbarger. Harshbarger votes aye. Miller Meeks. Miller Meeks votes aye. Obernolte. Guthrie.
Aye.
Guthrie votes aye. Eshue. Aye. Eshue votes aye. Sarbanes. Sarbanes votes aye. Cardenas. Cardenas votes aye. Ruiz. Ruiz votes aye. Dingell. Dingell votes aye. Custer. Custer votes aye. Kelly. Kelly votes aye. Barragan. Barragan votes aye. Blunt Rochester. Craig. Schreier. Schreier votes aye. Trahan. Trahan votes aye. Pallone. Pallone votes aye. Rogers. Rogers. Rogers votes aye.
How's Mr. Pence recorded?
Mr. Pence is not recorded. Mr. Pence votes aye.
Has Mr. Obernolte recorded?
Mr. Obernolte is not recorded. Obernolte votes aye.
Anyone seeking recognition for answer the roll call? Seeing none, the clerk will report.
Chair Guthrie, on that vote, there were 25 ayes and 0 noes.
With 25 ayes and 0 noes, the bill is agreed to. The chair calls up 6960 and asks the clerk to report.
H.R. 6960, a bill to amend the Public Health Service Act to reauthorize the Emergency Medical Services for Children program.
Without objection, the first reading of the bill is dispensed with, and the bill will be open for amendment at any time. Does anyone seek recognition on the bill? Gentlemen, want to seek recognition of the bill or offer amendment? Are there any?
Recognition.
Oh, no amendments, that's right. Gentleman's recognized, I'm sorry.
Thank you, Mr. Chairman. I move to strike the last word.
Gentleman's recognized.
Mr. Chairman, in Congress, and especially in this committee, we are focused on increasing the accessibility, affordability, and quality of health care for all patients, including children. That's why I'm pleased to see that my bipartisan bill, the Emergency Medical Services for Children Reauthorization Act, is included in this markup. This bill reauthorizes grants that focus on addressing the unique needs of children in emergency medical systems with the ultimate goal of reducing the prevalence of morbidity and mortality in children that may occur as a result of acute illness and severe injury. Mr. Chairman, I want to ask unanimous consent to submit a letter from more than 20 organizations representing patients, providers, hospitals, paramedics, and emergency medical technicians in support of this bill.
Without objection, so ordered.
Thank you, Mr. Chairman. For nearly 4 decades, the Emergency Medical Services for Children program has been the only federal grant program specifically focused on addressing the needs of children in emergency medical systems. As we know, children have special health care needs. Whether children require emergency care following a car crash or fall ill in the middle of the night with nowhere else to turn, our emergency medical system needs to have staff trained to treat children. A major part of that is providing the resources to equip healthcare professionals with the right size medical tools. As a pharmacist, I understand how critical it is that children receive care that is specialized to their unique needs. That's why I'm proud to be leading the reauthorization of the Emergency Medical Services for Children program, which is proven to be an effective approach for saving America's children. I'd like to thank Representative Castor, Dr. Joyce, and Dr. Schreier for working with me on this legislation, and I ask all of my colleagues to support this bill. Thank you, Mr. Chairman, and I yield back the remainder of my time.
Thank you. The gentleman yields back. Anyone seek Dr. Ruiz, recognized on the amendment, or excuse me, on the bill.
Yes, I also want to express my support for HR 6960, the Emergency Medical Services for Children Reauthorization Act, and I want to thank Republicans, Congressman Carter, Joyce, and Democrats Castor and Dr. Schreier, who's a pediatrician who knows very well the importance of pediatric care, for introducing this very important bill. More importantly, I want to introduce the men and women that are out there providing pre-hospital care and emergency situations for the millions of children who need EMS care. This bill is really going to help them get the resources they need and the confidence to better care for kids. There's nothing like taking care of a really sick child that puts an internist's anxiety at the highest level, because kids are not little adults. They have differences in the way that we approach them, especially during emergency situations. And I'm thinking about my good friend, Dr. Peter Antevi, who's a pediatric emergency physician and EMS director out in Florida, who developed a hand-heavy way of quickly helping paramedics determine the IV fluids needs for kids. It's brilliant. You can tell just by looking at counting your fingers and the age of the child. It's really, really remarkable stuff that's really led to better outcomes, because it's difficult. Sometimes it's difficult for doctors who take care of adults to remember the formula for fluids for kids. Imagine what it is for paramedics out in the field. So this is the type of legislation that will empower folks like Dr. Peter Antevi and all the pre-hospital care providers out in the field to better provide care for kids, our most precious treasure. And with that, I want to urge everybody to support this bill. And does anybody on our side want the rest of my time? Would you like it? I yield to Dr. Schreier.
Thank you, Dr. Ruiz. I'll see if I can get this in 2 minutes, and 2.5 minutes. I want to thank our chair and ranking member for working hard to move this important legislation. The Emergency Medical Services for Children Reauthorization Act is near and dear to my heart. I'm a pediatrician. I've seen in clinic how quickly a child can become medically unstable. And during training, of course, I worked in the emergency department, taking care of these acute, we say they're crumping children. And however scary it can be, in these dire straits, it is so much easier to manage that crisis in a controlled setting. And most people in the emergency medical setting outside of the hospital take care of adults. So they don't get as much practice with children, and that's where we can help. So I'm so proud to co-lead this reauthorization with Representatives Carter, Castor, and Joyce. This program supports research, training, grant funding, and data collection that has resulted in better emergency care and a decline in pediatric injury-related deaths by over 40% since the program began in 1984. I'll be voting yes today so we can continue to save the lives of children, and I encourage all of my colleagues to do so as well. And I yield back to Dr. Ruiz.
Thank you, and I yield back to the chairman.
Gentleman yields back. Any further discussion? Seeing none, are there any bipartisan amendments? Seeing none, are there any other amendments? Seeing none. The question now occurs on forwarding H.R. 6960 to the full committee, and a roll call has been requested. The clerk will call the roll.
Burgess. Burgess votes aye. Latta. Griffith. Bilirakis. Bilirakis votes aye. Bouchon. Bouchon votes aye. Hudson. Carter. Carter votes aye. Dunn. Pence. Crenshaw. Joyce. Joyce votes aye. Harshbarger. Harshbarger votes aye. Miller Meeks. Miller Meeks votes aye. Obernolte. Guthrie.
Aye.
Guthrie votes aye. Eschew. Aye. Eschew votes aye. Sarbanes. Sarbanes votes aye. Cardenas. Ruiz. Ruiz votes aye. Dingell. Dingell votes aye. Custer. Custer votes aye. Kelly. Kelly votes aye. Badagan. Badagan votes aye. Blunt Rochester. Craig. Craig votes aye. Schreier. Schreier votes aye. Trahan. Trahan votes aye. Pallone. Pallone votes aye. Rogers. Rogers votes aye.
How's Mr. Latta recorded?
Mr. Latta is not recorded. Latta votes aye.
Mr. Pence?
Mr. Pence is not recorded. Pence votes aye.
Anyone seeking to be recognized for the roll call? Seeing none, the clerk will report.
Chair Guthrie, on that vote, there were 22 ayes and 0 noes.
Mr. Dunn, are you recorded?
Mr. Dunn is not recorded. Dunn votes aye.
Just in time. Will the clerk will report?
Chair Guthrie, on that vote, there were 23 ayes and 0 noes.
With 23 ayes and 0 noes, the bill is agreed to. The chair will calls up H.R. 7153 and asks the clerk to report.
H.R. 7153, a bill to reauthorize the Dr. Lorna Breen Healthcare Provider Protection Act and
Without
for other
objection, the
purposes.
first reading of the bill is dispensed with, and the bill will be open for amendment at any point. So ordered. Does anyone seek recognition on the bill? What gentlelady from Iowa is recognized to speak on the bill?
Mr. Chairman, I move to strike the last word.
Gentlelady is recognized.
I'm glad to see H.R. 7153, Dr. Laura Breen Healthcare Provider Protection Reauthorization Act, included in today's markup. According to the Heroes Foundation, more than 400 physicians die each year by suicide, and rates of physician suicide differ by specialty. Notably, the original Dr. Laura Breen Healthcare Provider Protection Act that is currently law included Section 764, Programs to Promote Mental Health Among Healthcare Professional Workforce, to the Public Health Service Act. Under this section, HHS is authorized to award 3-year grants and contracts to healthcare entities to establish or enhance evidence-based or evidence-informed programs dedicated to improving mental health and resilience in the profession. With increasing rates of physician violence, burnout, violence in the workplace directed at healthcare providers, and existing workforce challenges, it's important for Congress to advocate for solutions to bolster America's medical professionals. Thank you, Mr. Chairman. I urge my colleagues to support this legislation, and I yield back.
Gentlelady yields back. The gentlelady from Michigan seek recognition to speak on the bill.
Mr. Chairman, I move to strike the last word.
Gentlelady is recognized.
I'm grateful that Dr. Lorna Breen Healthcare Provider Protection Act, which is legislation I'm leading alongside Representatives Wild, Carter, and Kiggins, is included as part of today's markup. Healthcare workers are the backbone of communities across America, and they work tirelessly to save patient lives every day, even at their own personal risk. But given the increasing stressors of the job, which are especially compounded in times of crisis, like the coronavirus pandemic, healthcare workers are experiencing rising rates of anxiety, stress, uncertainty, burnout, and lack of sleep. We must do more to support these workers who have dedicated their lives to keeping our communities healthy and safe, and that's why the legislation we are considering today is so critical. The legislation is named after Dr. Lorna Breen, who was a very dedicated, caring, compassionate physician in New York, who unfortunately died by suicide in April 2020. Just a few months after COVID-19 public health emergency was declared, because she was exhausted and anxious about the patients she was taking care of. The bill authorized important funding to support organizations in implementing evidence-informed strategies to reduce and prevent suicide, burnout, mental health conditions, and substance use disorders. The work is making a difference, and it's on us to reauthorize this program to ensure we can expand upon the progress we've already made. I also encourage my colleagues to help rip the Band-Aid off the stigma of mental health. What our healthcare workers went through during COVID was unbelievable. I had a nurse that I know in my own district that It's true, though, committed suicide. And then I started talking about it, and the hospital demanded a chamber take down my remarks. And I went back and said to the hospital, what are you doing? Support your healthcare workers. That's what we're doing here today. We owe it to Dr. Breen, her family, and every other healthcare worker to pass this reauthorization without delay. I urge all my colleagues to support it, and would you like me to yield to you, Dr. Ruiz?
Thank you. I really appreciate the comments by Congresswoman Dingell in recognition of the importance to see our physicians as human beings. Too often, physicians are portrayed as robots who are out to perform a duty, and they are. They're out to perform a duty, and they put others above self. In many circumstances, they don't eat normally, they don't sleep normally, they don't have normal relationships. As you know, there's a high divorce rate amongst physicians because they're always sacrificing for the betterment of others. And in policy, oftentimes doctors are castigated as the villains, out to scam a system or not, but in reality, doctors are the heroes where, and during COVID-19, under enormous amount of stress, away from family, stress about bringing COVID home to the family, stress about seeing the amount of deaths that oftentimes the military physicians who went to cover for in hospitals said they saw more death and suffering in urban hospitals during COVID-19 than they did in their entire military career. And so we really need to address this with the passage of this bill to provide the resources for physicians to heal themselves with other therapists, mental health therapists, so that they perform at optimal performance to take care of others. And so I thank my colleagues who introduced this bill, and I yield back my time to Ms. Dingell.
Will the gentlelady yield?
Oh, yes, most certainly.
Yeah, I just want to associate myself with Dr. Ruiz's comments, basically everything he said. Healthcare providers were on the front lines during COVID. They're on the front lines every day. And I think in the long run, we also need to try to address the fee schedule and physician-provider reimbursement in the long run. So I yield back.
Thank you, Mr. Chair. The physicians are critical. It's also the other healthcare workers, the nurses, and we need to thank them all. We just take them for granted, and they're heroes for us every single day. Thank you, and I yield back, Mr. Chairman.
Gentlelady yields back. The gentleman recognizes Mr. Carter from Georgia for 5 minutes to speak on the bill.
Mr. Chairman, I move to strike the last word.
Gentleman is recognized.
Mr. Chairman, the Dr. Lorna Breen Healthcare Provider Protection Act is landmark legislation supporting health workers' mental health and well-being. Since its passage in 2022, the Lorna Breen Act has enabled 44 organizations, including the American Society of Health System Pharmacists, to implement evidence-informed strategies that reduce and prevent suicide, burnout, mental health conditions, and substance use disorders. Unfortunately, the pharmacy workforce, like the rest of the healthcare workforce, is experiencing alarming rates of occupational burnout, moral injury, and stress. This legislation has also created a national campaign which gives healthcare leaders evidence-informed solutions to reduce health worker burnout, sustain well-being, and build a system where health workers thrive. But this is only scratching the surface. In October of 2023, the CDC released its Vital Signs report identifying a mental health crisis among health workers. The Lorna Breen Act is a lifeline for health workers, offering resources to address the mental health challenges they face. In addition to widening its reach to more hospitals, the reauthorization of the Lorna Breen Act also focuses on reducing the administrative burden for health workers everywhere. I encourage my colleagues to reauthorize the Dr. Lorna Breen Act, Healthcare Provider Protection Act, to ensure our healthcare workforce receives the support they need. Thank you, Mr. Chairman, and I yield back.
The gentleman yields back. Are there any discussion on the bill? Are there any bipartisan amendments on the bill? Seeing none, are there any other amendments on the bill? Seeing none, the question now occurs on forwarding H.R. 7153 to the full committee, and a roll call has been requested. Clerk will call the roll.
Burgess. Burgess votes aye. Latta. Griffith. Bilirakis. Bilirakis votes aye. Bouchon. Hudson. Carter. Carter votes aye. Dunn. Pence. Crenshaw. Crenshaw votes aye. Joyce. Joyce votes aye. Harshbarger. Harshbarger votes aye. Miller Meeks. Miller Meeks votes aye. Obernolte. Obernolte votes aye. Guthrie. Guthrie votes aye. Eshu. Eshu votes aye. Sarbanes. Sarbanes votes aye. Cardenas. Cardenas votes aye. Ruiz. Dingell. Dingell votes aye. Custer. Custer votes aye. Kelly. Kelly votes aye. Badagan. Badagan votes aye. Blunt Rochester. Craig. Craig votes aye. Schreier. Schreier votes aye. Trahan. Trahan votes aye. Pallone. Pallone votes aye. Rogers. Rogers votes aye.
Anyone, how's Mr. Dunn recorded?
Mr. Dunn is not recorded.
Mr.
Dunn
Pence?
votes aye.
Mr. Pence?
Mr. Pence votes
Mr.
aye.
Latta?
Mr. Latta votes aye.
Dr. Ruiz?
Ruiz votes aye.
Anyone else seeking recognition to answer the roll call? Seeing none, the clerk will report.
Chair Guthrie, on that vote, there were 25 ayes and 0 noes.
With 25 ayes and 0 noes, the bill is agreed to. The chair calls up H.R. 7251 and asks the clerk to report.
H.R. 7251, a bill to amend the Public Health Service Act to reauthorize certain poison control programs.
Without objection, the first reading of the bill is dispensed with, and the bill will be open for amendment at any point, so ordered. Does anyone seek recognition on the bill? Does anyone have, are there any bipartisan amendments to the bill? Gentleman from Pennsylvania, offer his amendment.
Mr. Chair, I have an amendment at the desk.
Clerk will report.
Amendment in the nature of a substitute to H.R. 7251, offered by Mr. Joyce.
Without objection, the reading of the amendment is dispensed with, and the gentleman from Pennsylvania is recognized for 5 minutes in support of the amendment.
Thank you, Mr. Chair. Today, I am pleased that we are considering H.R. 7251, a bill I helped introduce which would reauthorize funding for poison control centers. Continued support for these centers is critical to ensuring individuals and families have ready access to assistance when facing accidental poisoning or toxic exposure-related emergencies. I would like to thank Rep. Chavez de Reamer, the lead of this bill, as well as co-leads Rep. Davis and Rep. Phyllis McCormick for their work on this legislation. I would also like to thank Rep. Tonko and Rep. Carter for their support of this measure as well. This reauthorization will enable poison control centers to remain fully staffed by experienced professionals. These experts help save lives through their depth of knowledge and their prompt response during emergencies. When time is of the essence, the services of poison control centers and their staff is available to and relied upon by Americans and healthcare providers all across our country. As a member of the Energy and Commerce Health Subcommittee, I am glad to see continued work on this issue, which underscores the urgency of reauthorizing these centers. This AINS simply updates the dates of the underlying bill to reauthorize these important programs through fiscal year 2029, allowing poison control centers to continue their important work in the communities where they serve. I urge my colleagues to support this amendment and yield back the balance of my remaining time.
Gentleman yields back. Anyone seeking recognition for discussion on the amendment? Seeing if there's no further discussion on the amendment, the vote occurs on the amendment. All those in favor shall signify by saying aye. Aye. Those opposed, nay. The ayes have it, and the amendment is agreed to. Are there any other bipartisan amendments? Any other amendments? Seeing none, the question now occurs on forwarding H.R. 7251 as amended to the full committee. All those in favor, the clerk will call the roll. Roll call has been requested, so the clerk will call the roll.
Burgess. Burgess votes aye. Latta. Latta votes aye. Griffith. Bilirakis. Bilirakis votes aye. Bouchon. Bouchon votes aye. Hudson. Carter. Dunn. Pence. Crenshaw. Crenshaw votes aye. Joyce. Joyce votes aye. Harshbarger. Harshbarger votes aye. Miller Meeks. Obernolte. Obernolte votes aye. Guthrie.
Aye.
Guthrie votes aye. Eshue. Eshue votes aye. Sarbanes. Sarbanes votes aye. Cardenas. Cardenas votes aye. Ruiz. Ruiz votes aye. Dingell. Dingell votes aye. Custer. Custer votes aye. Kelly. Kelly votes aye. Barragan. Barragan votes aye. Blunt Rochester. Craig. Craig votes aye. Schreier. Schreier votes aye. Trahan. Trahan votes aye. Pallone. Rogers.
Dr. Miller Meeks, how is she recorded?
Miller Meeks is not recorded. Miller Meeks votes aye.
Mr. Pitts?
Pence votes aye.
Ranking Member Pallone?
Pallone is not recorded. Pallone votes aye.
Anyone seeking to answer the roll call? Seeing none, the clerk will report.
Chair Guthrie, on that vote, there were 23 ayes and 0 noes.
With 23 ayes and 0 nays, the bill is agreed to. The chair calls up H.R. 7224 and asks the clerk to report.
H.R. 7224, a bill to amend the Public Health Service Act to reauthorize the Stop, Observe, Ask, and Respond to Health and Wellness Training.
Without objection, the first reading of the bill is dispensed with, and the bill will be open for amendment at any point so ordered. Anyone seeking recognition on the bill? Mr. Cardenas, you're recognized to speak on the bill for 5 minutes.
Thank you, Mr. Chairman. I'm not a physician, but I would like to strike the last word. I will keep my remarks brief, but I do want to quickly discuss the value of the Stop, Observe, Ask, and Respond and Health Wellness Training Program. This program ensures that our health care providers at all levels are adept at identifying and assisting victims of human trafficking. And the program has already shown great promise. In fact, over 91% of training participants indicated they had at least a high confidence that they could identify and respond to human trafficking. This common sense bill extends this key program for our healthcare workforce and providers and hopes for, which provides hope for victims of these horrible crimes. I also want to thank my colleagues, Representatives Cohen, Wagner, and Carter, for co-leading this bill, and I urge members of the committee to support this legislation and vote aye on this legislation. With that, I yield back.
Gentleman yields back. Anyone else seeking recognition? To speak on the bill? Seeing none. The vote now occurs on the bill. First of all, are there any amendments to the bill? Seeing none, vote now occurs on the bill. A roll call has been requested, so the clerk will call the roll.
Burgess. Burgess votes aye. Latta. Latta votes aye. Griffith. Bilirakis. Bilirakis votes aye. Bouchon.
Aye.
Bouchon votes aye. Hudson. Carter. Dunn. Pence. Crenshaw. Crenshaw votes aye. Joyce. Joyce votes aye. Harshbarger. Harshbarger votes aye. Miller Meeks. Obernolte. Obernolte votes aye. Guthrie. Guthrie votes aye. Eshue. Eshue votes aye. Sarbanes. Sarbanes votes aye. Cardenas. Cardenas votes aye. Ruiz. Ruiz votes aye. Dingell. Dingell votes aye. Custer. Custer votes aye. Kelly. Kelly votes aye. Barragan. Barragan votes aye. Blunt Rochester. Craig. Craig votes aye. Schreier. Schreier votes aye. Trahan. Trahan votes aye. Pallone. Pallone votes aye. Rogers.
Anyone, how's Mr. Pence recorded?
Mr. Pence is not recorded.
How's the chairwoman recorded?
Pence votes aye. Chair Rogers is not recorded. Rogers votes aye.
How's Ms. Miller Meeks recorded?
Ms. Miller Meeks is not recorded. Miller Meeks votes aye.
Anyone else seeking recognition to vote? Seeing none, the clerk will report.
Vice Chair Buchan, on that vote, there were 24 ayes and 0 noes.
The ayes have it, and the bill is agreed to. The chair now calls up H.R. 6829 and asks the clerk to report.
H.R. 6829, a bill to amend the Public Health Service Act to authorize and support the creation and dissemination of cardiomyopathy education,
Without
awareness.
objection, the first reading of the bill is dispensed with, and the bill will be open for amendment at any point so ordered. Does anyone seeking recognition on the bill? I do. Are there any amendments to the bill? Recognize Mr. Pallone, ranking member.
Mr. Chairman, I have an amendment at the desk, Pallone 25.
Clerk will report the amendment.
Amendment in the nature of a substitute to H.R. 6829, offered by Mr. Pallone of New Jersey. Strike all.
Without objection, the reading of the amendment is dispensed with, and the gentleman from New Jersey is recognized for 5 minutes in support of the amendment.
Thank you, Mr. Chairman. I move to strike the last word and speak in favor of my amendment in the nature of a substitute to H.R. 6829, the Cardiomyopathy Health Education Awareness Research and Trainings in School Act or HEARTS Act of 2023. And my amendment authorizes public awareness activities and research into cardiomyopathy for a 5-year period beginning in 2025. It incorporates the bipartisan work of my colleagues, Representative Trifolis, McCormick, and Posey, by including a provision to direct the Secretary of Health and Human Services to award grants to elementary and secondary schools partnered with a nonprofit healthcare organization to develop and implement a comprehensive program to promote defibrillation access. According to recent data, an estimated 23 states have AED school requirements, with varying degrees of specificity regarding mandates on whether schools must have AEDs on campus and provide the necessary training on their use. And finally, my amendment also incorporates agency technical assistance and updates the materials and resources list to be more inclusive of other pediatric heart conditions. These bipartisan changes to the underlying bill are needed to improve the safety of students and improve the health of those afflicted with congenital heart disease. Now, ensuring that HHS has the resources and clear directives outlined in my aims will make certain that HHS collaborates across the department and with external stakeholders to raise awareness about the causes of sudden cardiac arrest. This aims will allow schools to be better equipped and have appropriate training tools and response plans to quickly respond to cardiac emergencies, and they can prevent tragic deaths. So I want to thank my colleagues and staff with the majority for working with me on the legislation. I'm proud that this bill, as amended, has the potential to save thousands of lives each year without the need to authorize any new federal spending. And I ask my colleagues for their support on this amendment and on the underlying bill, Mr. Chairman. Thank you, and I yield back.
Gentleman yields back. Any discussion on the amendment? I recognize myself for 5 minutes in support of the amendment. I'd like to express my support for Mr. Pallone's aims for H.R. 6829, the HEARTS Act. I'm grateful to committee staff on both sides of the aisle and advocates like the American Heart Association for negotiating a good legislative product in this bill. As a physician and former cardiothoracic surgeon, I know the importance of education and awareness on healthcare issues, and I'm very familiar with AEDs and the life-saving opportunities they provide. As I've shared before, I have experience with using a publicly available AED to help a stranger in need, recently at an airport. Cardiomyopathy is easily missed, especially among young, healthy people, but it can and does affect them in serious ways. I am confident this legislation, which supports education, awareness, research, and AED access in schools, will save lives, and I yield back. Is there further discussion on the amendment? Seeing none, the vote will now occur on the amendment. All those in favor say aye. All those opposed say no. The ayes have it. The amendment is agreed to. The vote now occur on H.R. 6829, and a recorded vote has been requested, so the clerk will call the roll.
Burgess. Burgess votes aye. Latta. Latta votes aye. Griffith. Bilirakis. Bilirakis votes aye. Bouchon.
I want to say this is the bill as amended. I forgot to mention that part. I vote aye.
Bouchon votes aye. Hudson. Carter. Dunn. Pence. Crenshaw. Crenshaw votes aye. Joyce. Joyce votes aye. Harshbarger. Harshbarger votes aye. Miller-Meeks. Obernolte. Obernolte votes aye. Guthrie. Guthrie votes aye. Eshue. Eshue votes aye. Sarbanes. Sarbanes votes aye. Cardenas. Cardenas votes aye. Ruiz. Ruiz votes aye. Dingell. Dingell votes aye. Custer. Kelly. Kelly votes aye. Badagan. Badagan votes aye. Blunt-Rochester. Craig. Craig votes aye. Schreier. Schreier votes aye. Trahan. Trahan votes aye. Pallone. Pallone votes aye.
Anyone else? How's Mr. Pence recorded?
Chair Rogers. Chair Rogers votes aye.
Oops. How's Mr. Pence recorded?
Mr. Pence is not recorded. Pence votes aye. Custer is not recorded. Custer votes aye.
Ms. Miller-Meeks?
Miller-Meeks is not recorded. Miller-Meeks votes aye.
Anyone else seeking recognition to vote? Seeing none, the clerk will report.
Chair Bouchon, on that vote, there were 24 ayes and 0 noes.
The ayes have it, and the bill is agreed to. The chair calls up H.R. 7189 and asks the clerk to report.
H.R. 7189, a bill to amend the Public Health Service Act to reauthorize a national congenital heart disease research, surveillance, and
Without
awareness-
objection, the first reading of the bill is dispensed with, and the bill will be open for amendment at any point so ordered. Does anyone seek recognition on the bill? Seeing none, are there any bipartisan amendments to the bill? Recognize Mr. Bilirakis for an amendment.
Thank you, Mr. Chairman. I have an amendment in the nature of a substitute at the desk.
Clerk will report.
Amendment in the nature of a substitute to H.R. 7189, offered by Mr. Bilirakis of Florida. Strike all after the enactment
Without
clause.
objection, the reading of the amendment is dispensed with, and the gentleman is recognized for 5 minutes in support of the amendment.
Thank you, Mr. Chairman. Thank you. I want to speak in support of my amendment and the underlying bill. H.R. 7189, the Congenital Heart Futures Reauthorization Act, and I urge my colleagues to support this bipartisan bill. This legislation will ensure the continued investments needed at HHS to understand and assess the lifelong needs of congenital heart disease, or CHD, remain for the next 5 years. At our legislative hearing, I discussed the evolving needs of congenital heart disease patients in the community needing access to specialized care throughout their lives. In fact, the current National Congenital Heart Disease Research, Surveillance, and Awareness Program specifically requires HHS to study and track the incidence of congenital heart disease to understand health outcomes for patients with CHD across all ages. However, too often, due to workforce challenges and education gaps, children with congenital heart defects who then age into adulthood face significant barriers to access to care. That's why I'm pleased we were able to come together in a bipartisan manner to offer the substitute amendment, which will require HHS to issue a report with a comprehensive assessment of all HHS activities related to congenital heart disease public awareness and knowledge, provide provider education and training, and workforce capacity nationwide. The AINS will then require HHS to develop a strategy with findings and recommendations to Congress on ways to improve efforts to increase public awareness and education, identify research gaps and opportunities, foster collaboration across sectors, and address workforce shortages for providers who treat adults living with congenital heart disease. This strategy will come in consultation with public and private stakeholder groups, such as patient advocacy organizations, healthcare professionals, insurers, research institutions, and relevant federal agencies such as CDC, NIH, and HRSA. I want to thank the committee for working with me on this initiative and thank Representative Soto for his efforts as well as bicameral support. We've been working with the Senate, Senator Durbin and Senator Young, on the Congenital Heart Futures Act. I urge my colleagues to support this very vital, crucial bill. The AINS, of course, and vote for the underlying bill, and I will yield back the balance of my time unless somebody needs it on my side of the aisle. All right, I yield back. Thank you, Mr. Chairman.
The gentleman yields back. Is there discussion on the amendment? Seeing if there's no further discussion, the vote occurs on the amendment. All those in favor signify by saying aye. All those opposed, nay. The ayes have it, and the amendment is agreed to. Is there any further discussion on the bill? Seeing none, the vote now occurs on H.R. 7189 as amended. A roll call vote has been requested. The clerk will call the roll.
Burgess. Burgess votes aye. Latta. Latta votes aye. Griffith. Bilirakis. Bilirakis votes aye. Bouchon.
Aye.
Bouchon votes aye. Hudson. Carter. Dunn. Crenshaw. Pence. Crenshaw votes aye. Joyce. Joyce votes aye. Harshbarger. Harshbarger votes aye. Miller Meeks. Miller Meeks votes aye. Obernolte. Obernolte votes aye. Guthrie. Guthrie votes aye. Eshue. Eshue votes aye. Sarbanes. Sarbanes votes aye. Cardenas. Cardenas votes aye. Ruiz. Ruiz votes aye. Dingell. Dingell votes aye. Custer. Custer votes aye. Kelly. Kelly votes aye. Batagon. Batagon votes aye. Blunt Rochester. Craig. Craig votes aye. Schreier. Schreier votes aye. Trahan. Trahan votes aye. Pallone. Pallone votes aye. Chair Rogers. Chair Rogers votes aye.
How's Mr. Pence recorded?
Mr. Pence is not recorded. Pence votes aye.
Anyone else seeking recognition to vote? Seeing none, the clerk will report.
Chair Bouchon, on that vote, there were 24 ayes and 0 noes.
The ayes have it, and the bill, as amended, is agreed to. The chair calls up 3916 and asks the clerk to report.
H.R. 3916, a bill to amend the Public Health Service Act to reauthorize and improve the National Breast and Cervical Cancer Early Detection Program.
Without objection, the first reading of the bill is dispensed with, and the bill will be open to amendment at any point so ordered. Does anyone seek recognition on the bill? Excuse me. Seeing none, are there any bipartisan amendments to the bill? Are there any other amendments to the bill? Gentlelady is recognized.
Thank you, Mr. Chairman.
Only has an amendment at the desk. The clerk will read it, report.
Amendment in the nature of a substitute to H.R. 3916, offered by Ms. Schreier. Strike all after the...
Without objection, the reading of the amendment is dispensed with, and the gentlelady is recognized for 5 minutes in support of the amendment.
Thank you, Mr. Chairman. Mr. Chairman, today I offer this amendment in the nature of a substitute, which reauthorizes this critical program, the National Breast and Cervical Cancer Early Detection Program, which provides access to breast and cervical cancer screening and diagnostic services for low-income, uninsured, or underinsured people in all 50 states, the District of Columbia, 2 U.S. territories, 5 U.S.-affiliated Pacific Islands, and 13 tribes or tribal organizations. This critical program is a true partnership between the CDC and state health departments. Since the program's beginning in 1991, it's served more than 61 million people, detecting nearly 77,000 invasive breast cancers and more than 24,000 pre-malignant breast lesions. It's estimated that in 2024, almost 1 million women will hear the words, "You have cancer," including 310,720 cases of breast cancer and 13,820 cases of cervical cancer. In testimony provided to the subcommittee, the American Cancer Society estimated that in 2024, nearly 42,000 women will die from breast cancer and 4,300 from cervical cancer. My AINS makes minor tweaks to the program to ensure clarity and flexibility in providing these needed services. The Screens for Cancer Act is an example of what can work in preventative health care screenings and has a proven track record of improving cancer screening and treatment in underserved populations. I urge my colleagues to support my AINS and also the underlying bill. Thank you. I yield the balance of my time.
Gentlelady yields. Is there discussion on the amendment? If there's no further discussion, the vote occurs on the amendment. All those in favor shall signify by saying aye. Aye. All those opposed, nay. The ayes have it, and the amendment is agreed to. The question now occurs on forwarding H.R. 3916 as amended to the full committee. All those in favor say aye. Aye. Opposed say no. A roll call has been requested, and so the clerk will call the roll.
Burgess. Burgess votes aye. Latta. Latta votes aye. Griffith. Bilirakis. Bilirakis votes aye. Bouchon.
Aye.
Bouchon votes aye. Hudson. Carter. Carter votes aye. Dunn. Pence. Crenshaw. Crenshaw votes aye. Joyce. Joyce votes aye. Harshbarger. Harshbarger votes aye. Miller-Meeks. Miller-Meeks votes aye. Obernolte. Obernolte votes aye. Guthrie. Guthrie votes aye. Eshue. Eshue votes aye. Sarbanes. Sarbanes votes aye. Cardenas. Cardenas votes aye. Ruiz. Ruiz votes aye. Dingell. Dingell votes aye. Custer. Kelly. Barragan. Barragan votes aye. Blunt Rochester. Craig. Craig votes aye. Schreier. Schreier votes aye. Trahan. Trahan votes aye. Pallone. Pallone votes aye. Rogers. Rogers votes aye. Mr. Pence is not recorded. Pence votes aye. Kelly is not recorded. Kelly votes aye.
Anyone else seeking recognition? Seeing none, the clerk will report.
Chair Bouchon, on that vote, there were 24 ayes and 0 noes.
The ayes have it, and the bill is agreed to. Chair now calls up H.R. 5074 and asks the clerk to report.
H.R. 5074, a bill to amend the American Taxpayer Relief Act of 2012 to delay implementation of the inclusion of the oral-only.
Without objection, the first reading of the bill is dispensed with, and the bill will be open for amendment at any time, so ordered. Does anyone seek recognition on the bill? I recognize myself for 5 minutes to speak on the bill. I would like to express my strong support for H.R. 5074, the Kidney Patient Act. The Kidney Patient Act was introduced in a bipartisan way with the admirable goal of providing physicians and renal disease patients with access to the best possible kidney care. As co-chair of the Congressional Kidney Caucus, I am very familiar with the issues facing dialysis patients and hear regularly about challenges with the end-stage renal disease bundled payment system. The Kidney Patient Act seeks to address one of those challenges by ensuring that oral-only phosphate binder medications are covered by Medicare Part D plans rather than being covered as part of the end-stage renal disease payment bundle. Placing these in the ESRD bundle would mean that virtually no patients use oral medications, which are proven to be highly effective for patients because dialysis facilities wouldn't provide them. Dialysis facilities already operate on a tight financial margin and don't have the infrastructure in place to offer this type of pharmaceutical drug. Patients that don't have access to a Medicare Part D plan wouldn't be excluded from using these medications as they could obtain them through patient assistance programs. I urge my colleagues to protect patient access to these important oral therapies and vote in favor of this legislation, and I yield back the balance of my time. Anyone else seek? Ranking Member Pallone.
Thank you, Mr. Chairman. I move to strike the last word.
Ranking Member is recognized.
Mr. Chairman, I have strong concerns with H.R. 5074, legislation that would keep a single class of drugs, namely oral-only phosphate binders, out of the Medicare and stage renal disease prospective payment system bundle. Any further delays in bringing this class of drugs into the ESRD bundle will negatively impact patient access to necessary medication and raise health care costs for our nation's seniors. In 2008, Congress passed the Medicare Improvements for Patients and Providers Act, or MIPPA, which created a bundle payment for renal dialysis services. A bundle payment for all items and services related to dialysis not only incentivizes lower cost, higher quality care, but also gives beneficiaries predictability and protection from high out-of-pocket costs, ensuring they are not hit with surprise bills for items and services outside of the ESRD bundle. While oral-only drugs were intended to be included in the ESRD bundle in 2014, Congress has since delayed their inclusion on 3 separate occasions, amounting to an 11-year delay. In fact, I'd like to enter into the record a New York Times article from around the time of one of the previous delays enacted in 2013, and this article is entitled "Big Senate Gift to Drug Maker," that criticizes the delay of oral drugs into the ESRD bundle as an unnecessary giveaway to industry and that puts financial interests over best clinical practice. And now we're here today in 2024, once again contemplating a further delay of bringing these important drugs into the ESRD bundle. Now, oral-only phosphate binders are currently the only remaining item that remains outside the ESRD bundle payment other than new technologies which are separately paid on a temporary basis. The continuing efforts of the manufacturers of these drugs to keep the drug outside of the bundle negatively impacts Medicare beneficiaries who bear the higher cost of paying separately for these drugs. And these oral-only ESRD drugs are crucial for over 60% of patients on dialysis who rely on them to regulate their phosphate levels. However, 1 in 5 Medicare patients on dialysis do not have Part D coverage. Their access to these important drugs will be improved by bringing the drug into the ESRD bundle in Medicare Part B. And some proponents of this bill have tried to brush off this reality, arguing without evidence that these beneficiaries have access to these drugs through other forms of supplemental coverage. But that is convenient for them to assume, but according to the Medicare Payment Advisory Commission, patients on dialysis who do not have Part D coverage are actually far less likely to have coverage from other sources than other Medicare beneficiaries. The reality, Mr. Chairman, is that for many seniors without Medicare Part D, they will have to pay hundreds or even thousands of dollars in out-of-pocket just to access these medications. In fact, the price of just one of the newer drugs in this class is a whopping $35,520 per year, and that's approximately $2,960 a month for patients without Part D coverage. It's nearly the cost of providing dialysis for an entire year to a Medicare beneficiary. I frankly think it's shocking. Another delay in bringing this drug into the ESRD bundle will lock seniors out of coverage for necessary medication or force them to pay thousands of dollars in out-of-pocket just to access these medications. So I'm also concerned that this bill would further exacerbate gaps in health outcomes. Black patients are 3 times more likely to experience kidney failure than white people, and 1 in 3 Black Medicare beneficiaries will be diagnosed with chronic kidney disease in their lifetime. While only 10% of Medicare beneficiaries are Black, nearly 30% of dialysis patients are Black. Additionally, Black patients are more likely to report difficulty according to their prescription drugs. Another delay would extend unequal access to necessary medications and result in high out-of-pocket drug costs for minority and medically underserved communities. CMS has found that inclusion of oral drugs into the bundle increases utilization and increases access for minority communities. In 2018, oral calcimimetics were incorporated into the bundle, and subsequently, CMS observed increased access and high utilization among Black and Hispanic patients. So finally, I'd like to address the arguments made by some stakeholders that somehow the dialysis industry is not ready for this change. In fact, CMS has communicated they are ready to include these drugs in the ESRD bundle beginning in 2025. In a recent report, the USGAO found that dialysis organizations have the capacity to dispense oral-only ESRD drugs to Medicare beneficiaries, and that they currently already dispense oral drugs to seniors. Another delay is, in my opinion, unnecessary and will only harm patients' access to these drugs. For over a decade, there's been delays in moving oral-only drugs into the Part B ESRD bundle, resulting in a lack of access to coverage for seniors, and I believe it's time we close this loophole. So I urge my colleagues to oppose the bill, and I yield back, Mr. Chairman. Thank you.
Gentleman yields back. Anyone else seeking recognition? Mr. Carter from Georgia, recognized for 5 minutes.
Mr. Chairman, I move to strike the last word.
Gentleman's recognized.
Mr. Chairman, I'm proud to join my colleagues, Representative Custer, in introducing the Kidney Patient Act, which supports chronic kidney disease patients' access to life-saving oral-only drugs using Medicare Part D. There are more than 1 in 7 adults, or about 35.5 million people living with chronic kidney disease in the United States. Many of these patients have kidney failure and are on dialysis up to 3 days a week, often leaving fatigued. One of the biggest challenges patients with kidney failure experience is managing high levels of phosphate in their blood, which can heighten the risk for heart attack or stroke if left untreated. The standard of care for high phosphate is medication, known as phosphate-lowering therapies or PLTs. And these drugs must be taken outside of the dialysis setting, since they must be taken with food, and you are prohibited from eating in the dialysis setting. Patients currently have access to these drugs, but that would change under CMS's plan to add phosphate-lowering therapies into Medicare Part B end-stage renal disease prospective payment system by 2025. This would threaten kidney disease patients' access to life-saving medications and increase costs for dialysis treatments. The Bipartisan Kidney Patient Act will delay this move until 2033, or until new therapies come to the market, extending patients' ability to access oral-only drugs through Medicare Part D. It makes no sense for CMS to bring these drugs into the bundle, given that patients are not supposed to have any food or drink during dialysis. Furthermore, according to the Congressional Budget Office, moving the phosphate-lowering drugs into the bundle will increase Medicare Part B premiums for all beneficiaries. The Kidney Patient Act is common-sense legislation that will ensure patients with severe kidney disease who are on dialysis can continue to receive quality health care. It also has broad community support from more than 70 organizations representing patients, providers, and advocates in support of this bill. I'd also like to read a statement from a patient in Georgia who will be negatively impacted if CMS moves these oral-only phosphate-lowering therapies into the bundle. She says, and I quote, "Ensuring the passage of the Kidney Patient Act is crucial for safeguarding the well-being of dialysis patients," unquote. I encourage my colleagues to support the Kidney Patient Act before us today and protect end-stage renal disease patients across the country. Thank you, Mr. Chairman, and I yield back.
Gentleman yields back. Anyone else seeking recognition to speak on the bill? Dr. Joyce, recognized for 5 minutes.
Thank you, Mr. Chairman. Currently, oral-only phosphate-lowering drugs are covered under Medicare Part D prescription drug benefit, which provides broad coverage to a range of phosphate management therapies at low out-of-pocket cost to the patient. By moving these drugs, which are taken by most dialysis patients, to the ESRD payment bundle, CMS risks making these drugs less accessible and less affordable to those who need it. Because phosphate-lowering medications are taken multiple times during the day with meals and snacks, patients cannot take them during dialysis because meals and snacks are often delayed, and ESRD clinics are not appropriate venues to handle these medications. Congress has stepped in before to delay this change, and I am proud to support H.R. 5074, which would again maintain better coverage for beneficiaries. This is an important step to ensure that ESRD patients maintain access to care under Medicare. I would also like to highlight H.R. 6860, a bill that, while not being considered during this markup, would support dialysis patients with private coverage whose employer-sponsored coverage is under threat. Thank you, Mr. Chair, and I yield back.
Gentleman yields back. Any further discussion on the bill? Seeing none, are there any bipartisan amendments to the bill? Seeing none. Are there amendments to the bill? Also seeing none. I am. Yeah. The question now occurs on forwarding H.R. 5074 to the full committee. A roll call vote has been requested. The clerk will call the roll.
Burgess. Burgess votes aye. Latta. Latta votes aye. Griffith. Griffith votes aye. Bilirakis. Bilirakis votes aye. Bouchon. Bouchon votes aye. Hudson. Carter. Carter votes aye. Dunn. Dunn votes aye. Pence. Crenshaw. Crenshaw votes aye. Joyce. Joyce votes aye. Harshbarger. Harshbarger votes aye. Miller Meeks. Miller Meeks votes aye. Obernolte. Obernolte votes aye. Guthrie. Guthrie votes aye. Eshoo. Eshoo votes no. Sarbanes. Sarbanes votes no. Cardenas. Cardenas votes no. Ruiz. Ruiz votes no. Dingell. Dingell votes no. Custer. Kelly. Badagon. Badagon votes aye. Blunt Rochester. Craig. Craig votes no. Schreier. Schreier votes no. Trahan. Trahan votes no. Pallone. Pallone votes no. Rogers. Rogers votes aye.
How's Mr. Pence recorded?
Pence votes aye.
How's Ms. Kelly recorded?
Kelly's not recorded. Kelly votes no.
Anyone else seeking recognition to vote? Seeing none, the clerk will report.
Chair Bouchon, on that vote, there were 16 ayes and 10 noes.
The ayes have it, and the bill is agreed to. Chair now calls up H.R. 5526 and asks the clerk to report.
H.R. 5526, a bill to amend Title XVIII of the Social Security Act to clarify the application of the in-office ancillary services exception.
Without objection, the first reading of the bill is dispensed with, and the bill will be open for amendment at any point so ordered. Does anyone seek recognition on the bill?
I do.
Which two? Sure. Recognize Ms. Eshoo, 5 minutes.
Thank you, Mr. Chairman. I seek recognition to strike the last word and speak on this bill. During the pandemic, many cancer patients were able to get their drugs mailed directly to them from their doctors, from their oncologists, but that flexibility ended when the public health emergency ended. So this legislation that we're voting on today simply extends this common sense policy so that independent physicians with on-site pharmacies can mail their patients their drugs instead of making them come in person to pick them up. I could stop right here, but I'm going to add some more things to this because more than anything else, I think this is common sense. But it's also important because about 15,000 independent oncologists in our country have on-site pharmacies as part of their practices. In my district, I have 3 independent oncologists with on-site pharmacies. Integrating pharmacies with a doctor's office may improve care for patients by reducing the wait times between diagnosis and treatment, improving patient monitoring, and enhancing medication adherence. For example, an in-house pharmacy can alert physicians to intervene when patients miss a prescription or if there's an issue with prior authorization. In-house pharmacies can also be more easily more easily provide shorter prescriptions than the typical 90-day prescriptions offered by the big chains. This is good for cancer treatments or cancer patients whose treatments change frequently in response to how they're improving. Independent oncology practices that prescribe and fill cancer drugs on site can also save patients and Medicare money. Last month, JAMA published an investigation by Harvard economists Dr. Kakani and Dr. Cutler that found that point-of-sale prices for high-cost drugs filled by in-house pharmacies was 1.76% lower than other pharmacies, which are mostly owned and controlled by PBMs. That should set some members of this committee off, since we're all on the same page on PBMs. On-site pharmacies saved an average of $800 for high-cost drugs per patient annually. Now, some of my colleagues oppose the bill because they're concerned that physicians will have the financial incentive to overprescribe if they're allowed to mail the drugs. But I think this concern really misses a few important good points. First, it's already legal for these doctors to refer their patients to their on-site pharmacy, so the financial incentive already exists. Second, if Medicare identifies overprescribing, then it has the authority from Congress to deny improper claims. My view is we shouldn't create barriers to care for Medicare beneficiaries, especially cancer patients, because of an unproven concern about potential overprescribing. This legislation will make sure cancer patients don't have to worry whether they'll be too sick to make the drive to their oncologist's office to pick up their drugs, which is a very good reason, I think, to vote for the legislation. So thank you, Mr. Chairman, and I yield back.
Gentleman yields back. Who else seeks recognition on the bill? Mr. Carter, recognized for 5 minutes.
Mr. Chairman, I move to strike last word.
Gentleman's recognized.
As a pharmacist, I know firsthand the importance of cancer patients getting their medications in a timely manner without any obstacles. Oncology practices should easily be able to deliver the medications they dispense or have a family member pick up the medications for them. However, CMS is suggesting that patients should rely on PBM mail service to get their medications. This is a non-starter because there will be delays and denials. We need to pass this simple solution, this NHR 5526, the Seniors Access to Critical Medications Act, for the sake of Medicare seniors and those disabled. This is why I applaud Representative Harshbarger for introducing this bill, and I urge my colleagues to support it. Does anyone want me to yield? Diana?
Yeah, thank you.
I yield to Representative Harshbarger.
Okay, thank you, Representative Carter. I want to speak in support of this bill. I appreciate Chair Guthrie and Rogers and Ranking Members Eshoo and Pallone for including consideration of this bipartisan Seniors Access to Critical Medications Act. And I want to thank the 20 bipartisan members of the Energy and Commerce Committee who've joined in co-sponsoring this crucial bill. We have 57 total bipartisan co-sponsors to date. And there's a bipartisan Senate companion bill being championed by Senators Blackburn and Sinema. And my colleagues will recall my focusing many times on this tremendously important issue for Medicare cancer patients and others with serious diseases to ensure they have timely access to their appropriate life-saving medications. And, you know, I've been a community pharmacist for over 35 years, and no mission is more important and fundamental than this one. CMS has communicated that it is a Medicare Stark violation if a medical practice, such as a community oncology practice, delivers a prescribed and filled drug to a patient via mail, courier, UPS, FedEx, or other means, or even allows a family member or caregiver to pick up a patient's drug. CMS insists that the patient is personally required to pick up their medications from their provider. However, if Medicare seniors are too sick, if they live in a rural area, or simply don't have reliable transportation, in-person pickup of their vital medications is just not possible. And we shouldn't put obstacles in the way of cancer patients or patients receiving their needed medications. So the Seniors Access to Critical Medications Act is a short and relatively simple bill all about ensuring cancer and other patients have timely access to their appropriate oral medications. It would allow delivery of Medicare oral medications or allow a family member or caregiver to pick up these needed medications, just as these clinicians have been doing prior to the pandemic. And I've heard from dozens and dozens of Tennessee oncologists and patients, as well as many others around the country, who've said this is a major problem, negatively impacting patients across the country. I have this, I commend my colleagues' attention to this Stat News column from March 1st, 2024, entitled New Federal Guidance is Hurting Cancer Patients, Especially Those in Rural Areas. It's authored by an oncologist in rural Tennessee, and this piece crystallizes and illustrates the necessity of H.R. 5526 and how current CMS rules are frustrating providers and posing significant harm to cancer patients with obstacles to getting their appropriate care they need in a timely manner. And to quote briefly from the author at Tennessee Oncology, they say, this befuddling CMS rule interpretation has led to serious disruptions in the world of community oncology, where the vast majority of Americans receive their cancer care, and reveals a limited understanding of the evolution in medical therapy and practice over the past decade, and has a disproportionate effect on rural patients because half of that physician's patients receive their oral anti-cancer medications by mail. The current CMS rule interpretation isn't just hurting patients, it's also exasperating waste, driving up healthcare costs. If a drug shipped out to a satellite clinic isn't picked up because of the disease progression leading to a regimen change, toxicity leading to a treatment pause or hospitalization, it's ineligible to be restocked and must be discarded. Tennessee Oncology has calculated that this led to millions of dollars of drug wastage at a time when we're experiencing catastrophic chemo drug shortages. I ask unanimous consent for this Stat News column to be included in the subcommittee's record.
Without objection, so ordered.
Okay. I truly appreciate my committee colleagues from both sides of the aisle who support this vital legislation. I want to thank the chair, and I urge my colleagues to support advancing H.R. 5526, and with that, I yield back.
Mr. Chairman, I yield back.
Gentleman yields back. Who else seeks recognition? Mr. Pallone, the ranking member, is recognized. 5 minutes.
Thank you, Mr. Chairman. I'm very concerned that this bill would create a giant loophole in the physician self-referral law, commonly known as the Stark Law. The Stark Law prohibits physicians from making referrals to entities in which the physician has a financial stake unless that relationship satisfies one of a few statutory exceptions. For example, the Stark Law explicitly prohibits physicians from referring outpatient prescriptions to pharmacies that they own or have a financial stake in. I believe the law and its narrow exceptions are critical in protecting Medicare beneficiaries by ensuring that financial considerations do not influence patient care, that provider decisions are made on the basis of clinical criteria, and to protect the integrity of the Medicare program. The law includes specific and narrowly tailored exceptions, such as the in-office ancillary service exception, which permits a physician with an ownership stake to provide an outpatient prescription drug or certain service to a patient at his or her office as part of an in-person visit. And this is for the convenience of the patient, but also because there are more limited program integrity concerns when the item or service is being delivered as part of an in-person office visit. But during the COVID-19 pandemic, the Centers for Medicare and Medicaid Services provided a limited waiver from the Stark Law by waiving the location requirement of the in-office ancillary service exception. I believe this waiver was necessary to protect vulnerable patients during the public health emergency, which has now expired. But this bill, H.R. 5526, would significantly broaden the exemptions under the Stark Law and would undermine the integrity of the Medicare program. The bill would allow providers to operate mail-order pharmacies out of their practices permanently. Medicare Part D already provides robust coverage for outpatient prescription drugs, and Part D plans are required to ensure beneficiary access to in-network or retail pharmacies, including through delivery via mail order. CMS, the Department of Justice, Department of Health and Human Services, Office of Inspector General aggressively investigate and prosecute billions of dollars in healthcare fraud, waste, and abuse each year, which in turn prevents losses to the Medicare Trust Fund and keeps healthcare costs low for seniors. Carving out additional exemptions under the Stark Law undermines this critical work. I also believe HHS, OIG, and law enforcement agencies are concerned this bill would undermine their ability to protect the integrity of the Medicare program. Just go to the DOJ's website and you will find many examples of Medicare mail order fraud schemes. In one recent case, providers ordered $50 million in fraudulent mail order prescriptions and durable medical equipment such as lidocaine and diabetic testing supplies that patients did not need or want. These companies were billing Medicare with no evidence that any of the seniors wanted these items or services or even received them. In another case, providers ordered over $1 billion in unnecessary genetic tests and durable medical equipment via a mail order scheme. H.R. 5526 would significantly weaken the Stark Law, paving the way for more fraud and abuse in the Medicare program. In fact, the Congressional Budget Office estimates the bill has significant scoring implications due to incentivizing providers to prescribe more medications. Now, while I have strong concerns with significantly weakening the Stark Law, I believe there are limited instances in which it may be necessary for a caregiver or a family member to pick up the prescription drug for patients, which is currently prohibited under the Stark Law. I believe there are limited program integrity concerns in these instances, and limiting it to only caregivers or family members would also address my concerns regarding fraud, waste, and abuse. And I am disappointed we could not reach a bipartisan agreement with the majority on this alternative approach that I propose. Patients deserve, Mr. Chairman, access to treatment that is medically appropriate for them. And the Stark Law ensures that patients receive care based on medical necessity and not based on whatever treatment makes their provider the most money. I can't support a bill that would undermine patient safety, jeopardize the integrity of the Medicare program, and raise health care costs for seniors. So I urge my colleagues to oppose the bill. Again, Mr. Chairman, I thank you and yield back.
The gentleman yields back. Who else seeks recognition? Mr. Griffith, recognized for 5 minutes.
Thank the gentleman for the 5 minutes. While we disagree on the underlying purpose of the bill or import of the bill, Mr. Pallone has just made a point that I wanted to make to this full committee. Prosecution of any violations of the Stark Act would fall under the False Claims Act. False Claims Act carries with it a penalty not to exceed 5 years in the penitentiary and $250,000 fine, up to $250,000 fine for individuals, $500,000 fine for corporations, as I understand it. You say, why are you bringing this up, Morgan? And the answer is that the CMS folks have indicated to us they believe that this was always a violation of Stark, even prior to COVID, and yet prior to a ruling in September of 2021, Mr. Chairman, CMS did not interpret the law that way. But if they now maintain that their position was that the law was always that this was a violation of Stark, any medical practice or doctor who did this prior to the frequently asked question determination by CMS between the years of 2014 and September of 2021 could be subject to punishment under the False Claims Act. That's why I think it was extremely wonderful that Mrs. Harshbarger's bill says it's a clarification of the application. because this is not new. It's been done since the beginning of this process in 2006. I think we have to pass this in order to make sure that we're clarifying the law and everybody understands that those doctors who were acting in accordance with what CMS determined the law to be at the time, or at least they didn't say it was a violation of the law, are not subject to prosecution. Now, from 2006 to 2014, you can argue that the statute of limitations already ran, at least up until March 11th of that year, because we haven't finished the 12th yet. I certainly hope CMS isn't looking to bring any stark false claim acts against these physicians who've been helping patients in all of our districts. But if we do not pass this, we'll be sending a green light that those prosecutions could go forward. I think we need to clarify the law that this was the law all along, and Ms. Harshbarger's bill should be passed, and I yield back.
Gentleman yields. Anyone on the Democrat side want to speak? Recognize Ms. Schreier, 5 minutes.
Thank you, Mr. Chairman. I'll be voting no on H.R. 5526. In many ways, it seems like a solution without a problem. 90% of Americans live within 5 miles of a pharmacy. I do agree with my friend Representative Carter that it doesn't make sense for traditional mail order pharmacies, the PBM pharmacies, to be sending prescriptions because there is a delay, but local pharmacies already can send prescriptions to their patients. So it would be very easy for a physician, for example, to electronically transmit a prescription to a local pharmacy, and that pharmacy could then mail it. Also, already family and friends can pick up prescriptions for their loved ones. And so the issue of driving when ill is something that just it isn't a real issue in most cases right now. Now, I do also agree with Representative Eshoo that there should be an exception for oncology because those are specialized medications often not carried by traditional pharmacies, and it is the kind of thing where medication adjustments can happen. So I think we can work together. I see an opportunity to work together in a bipartisan way to create a bill that could get support from both parties. And with that, I yield back.
Gentlelady yields. Recognize Ms. Miller Meeks for 5 minutes.
Thank you very much, Mr. Chair. And I just want to point out that many of the bills that we're discussing this morning have been about supporting physicians and patients all morning long, and that's what this bill does. And then I'm going to also say, as a provider who has gone out of my way to treat patients in rural areas and put many windshield miles on and even driven patients into my office for procedures, I find it offensive for physicians to continually be labeled by certain members as only wanting to line their own pockets. Hospitals are able to mail drugs to patients. This bill just allows physician practices to do it. We also have an integrated vertical system of PBMs owned by health insurance companies who also own providers. And why isn't that considered a violation of the Stark Law? And why are we not talking about that, as Ms. Eshoo pointed out when talking about the PBMs? Further, as far as how far patients live from their providers, a new study presented last week at the ASCO Quality Care Symposium found that recent CMS decision to limit the delivery of cancer medications imposes a substantial burden on patients, particularly those living in socioeconomically disadvantaged neighborhoods. Let me continue. The study identified a total of 970 patients who received home-delivered prescriptions under traditional Medicare Part D. Of these patients, 71% resided within a 20-mile radius of the nearest clinic, while 22% lived between 20 and 50 miles away. Furthermore, 7% lived more than 50 miles from the closest clinic, and 60 addresses could not be properly matched to an Area Deprivation Index, ADI database, which is a measure of neighborhood socioeconomic disadvantage. When considering the ADA rankings, 40% of patients living within 20 miles of the clinic face significant risk of disparity, a figure that rose to 67% for those residing within 20 to 50 miles away, and 61% for individuals living more than 50 miles away from their clinic. Let me just say that the pandemic underscored to everyone that we have laws and regulations that we don't need. Let me just, for instance, suggest telehealth. And everyone in this room was in favor of extending the waivers that were granted for telehealth from Medicare, because what the pandemic underscored was that it increased access to care and it was favorable to patients. This is another one of those regulations that we are now imposing that we do not need, and especially when it comes to oncologic drugs, which are short-acting, have numerous side effects, so I don't think overprescription is going to be a problem by patients, and has frequent changes in accordance with the patient's status of their treatment. So I'm in favor of Ms. Harshberger's legislation. I hope that all of our colleagues will support it, will support physicians and patients in rural areas, and I yield back.
Gentlelady yields back. Anyone else seeking recognition on the bill? Any bipartisan or other amendments to the bill? Seeing none. The question now occurs on forwarding H.R. 5526 to the full committee. A roll call vote has been requested. The clerk will call the roll.
Burgess. Burgess votes aye. Latta. Griffith. Griffith votes aye. Bilirakis. Bouchon. Bouchon votes aye. Hudson. Carter. Carter votes aye. Dunn. Pence. Crenshaw. Joyce. Joyce votes aye. Harshbarger. Harshbarger votes aye. Miller-Meeks. Miller-Meeks votes aye. Obernolte. Obernolte votes aye. Guthrie. Guthrie votes aye. Eshue. Eshue votes aye. Sarbanes. Sarbanes votes no. Cardenas. Ruiz. Ruiz votes aye. Dingell. Custer. Kelly. Kelly votes aye. Badagan. Badagan votes aye. Blunt-Rochester. Craig. Craig votes no. Schreier. Schreier votes no. Trahan. Trahan votes no. Pallone. Pallone votes no. Chair Rogers. Chair Rogers votes aye.
Mr. Latta? How's Mr. Latta recorded?
Mr. Latta is not recorded. Latta votes aye.
How's Mr. Bilirakis recorded?
Mr. Bilirakis is not recorded. Bilirakis votes aye.
How's Mr. Dunn recorded?
Mr. Dunn is not recorded. Dunn votes aye.
Mr. Pence, how's he recorded?
Pence votes aye.
Mr. Cardenas, how's he reported?
Mr. Cardenas votes aye.
How's Ms. Dingell recorded?
Dingell is not recorded. Dingell votes no.
Seeing no one else seeking recognition to vote, the clerk will report.
Chair Bouchon, on that vote, there were 19 ayes and 6 noes.
The ayes have it, and the bill is agreed to.
The chair calls up H.R. 2706 and asks the clerk to report.
H.R. 2706, a bill to prohibit discrimination on the basis of mental or physical disability in the cases of organ transplants.
Without objection, the first reading of the bill is dispensed with, and the bill will be open for amendment at any point. So ordered. Does anyone seek recognition on the bill? The chair recognizes Dr. Miller-Meeks for 5 minutes to speak on the bill.
Mr. Chairman, I move to strike the last word.
Gentlelady's recognized.
Thank you, Mr. Chairman. I'm proud to co-sponsor H.R. 2706, the Charlotte Woodward Organ Transplant Discrimination Prevention Act, which prohibits entities from determining that an individual is ineligible to receive a transplant or related services based solely on the fact that the individual has a disability, either intellectual or physical. Currently, 40 states across the country have a non-discrimination law in place to expressly prohibit organ transplant discrimination against individuals with disability, but there is still need for federal protections to ensure that individuals with disabilities across the country are afforded the same legal protections. Thank you, Mr. Chairman. I urge my colleagues to support this legislation, and I yield back.
Gentlelady yields back. Does anyone seeking discussion on the bill? Are there any bipartisan amendments? Gentlelady is recognized. Gentlelady from Michigan is recognized to offer her amendment.
Mr. Chairman, I have an amendment in the nature of a substitute at the desk.
The clerk will report the amendment.
Amendment in the nature of a substitute to H.R. 2706, offered by Ms. Dingell. Strike
Without
all-
objection, the reading of the amendment is dispensed with, and the gentlelady is recognized for 5 minutes in support of her amendment.
Thank you, Mr. Chairman. This amendment makes technical changes to H.R. 2706, the Charlotte Woodward Organ Transplant Discrimination Prevention Act, which is legislation that I'm very proud to lead alongside Representative Kat Kamick. This bill prohibits discrimination against people with disabilities in the organ transplant system by ensuring eligible individuals are not declined a life-saving transplant based solely on their disability. It's named after Charlotte Woodward, an incredible young woman who was actually here on the day in the audience when we had hearings, who was born with Down syndrome, who received a life-saving heart transplant in 2012. Today, she has dedicated her life to advocating for people with disabilities to receive equal access, and she inspires me every time I meet with her. It's unconscionable that people with disabilities are passed over for life-saving transplants based on discriminatory and subjective assumptions about their ability to comply with post-operative care. With this legislation, we can take concrete steps to ensure all patients receive equitable access to care, regardless of their disability status. I remain committed to working with my colleagues to ensure we get this bill right by the time it comes to full committee. I urge all of my colleagues to support it. Thank you, Mr. Chairman, and I yield back.
The gentlelady yields back. Any discussion on the amendment? If there's no further discussion on the amendment, the vote occurs on the amendment. All those in favor shall signify by saying aye. Aye. All opposed, nay. The ayes have it, and the amendment is agreed to. Are there any other amendments? Seeing none, the question now occurs on forwarding H.R. 2706 as amended to the full committee. All those in favor say aye. Aye. All opposed, no. The ayes have it, and the bill is agreed to. The chair calls up H.R. 5012 and asks the clerk to report.
H.R. 5012, a bill to improve research and data collection on stillbirths and for other purposes.
Without objection, the first reading of the bill is dispensed with, and the bill will be open for amendment at any point. So ordered. Does anyone seek recognition on the bill? What person, the gentleman from Texas, seek recognition?
Speak on the bill.
The gentleman is recognized.
Thank you, Mr. Chairman. This Stillbirth Health Improvement Education Act is an important bill before us, and I urge members on both sides to support it. Despite medical advances, the stillbirth rates have barely changed over the past 30 years. So we need accurate data to understand the underlying causes of stillbirth. By awarding grants for surveillance and data collection on stillbirths, H.R. 5012 helps gather crucial information to better understand the causes and risk factors associated with stillbirth. This data is essential for informing public health policies and providing interventions aimed at reducing the stillbirth rates. I believe this bill is a step in the right direction to raise awareness among healthcare providers, expecting parents and the public. Increased awareness can lead to early detection of risk factors, better management during pregnancy, and the potential for fewer stillbirths. I urge adoption, and I yield back.
Gentleman yields back. Are there any discussion on the bill? Seeing none, are there any bipartisan amendments to the bill? Seeing none, are there other amendments to the bill? Seeing none, the question now occurs on forwarding H.R. 5012 to the full committee. All those in favor say aye. 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 All those opposed, no. The ayes have it, and the bill is agreed to. The chair calls up H.R. 7208 and asks the clerk to report.
H.R. 7208, a bill to reauthorize the Traumatic Brain Injury Program. Be it enacted by the Senate and
Without
House-
objection, the first reading of the bill is dispensed with, and the bill will be open for amendment at any point so ordered. Does anyone seek recognition on the bill? Are there any bipartisan amendments? I have an amendment at the desk. In nature of a substitute, it is the Crenshaw Amendment 1.
Amendment in the nature of a substitute to H.R. 7208, offered by Mr. Guthrie.
Without objection, the first reading, Heard the amendment. Without objection, the reading of the amendment is dispensed with, and I will recognize myself for 5 minutes to speak on the amendment. I'm offering this Ains for the Traumatic Brain Injury Reauthorization Act and want to speak in support of the amendment, which is sponsored by Representatives Pasquarello and Bacon. There are true leaders in combating TBI. To give you an idea, 5 million Americans live with TBI. For military, the estimate is that 30% of our service members experience some type of brain injury, and it's a similar number for law enforcement. Here's why it matters. We know post-traumatic stress disorder and suicide are linked to TBI. It is estimated that 1/3 of veterans have PTSD, and almost 1/5 of police officers have PTSD. They face a lifetime of issues, and the least we can do is fund more research and support those who are injured. That's why reauthorizing programs to support people with TBI is so important. The research helps everyone. We also have to do more. We have to make sure our best information doesn't sit in an agency in Washington, D.C., and we also have to connect people to that research and continue to update the best practices for preventing, identifying, and treating TBI. This amendment makes necessary technical changes while ensuring the existing program is more focused on delivering targeted research and results. It also focuses our government on the issues of chronic brain injury. And I can yield to the gentleman from Texas, but you may want your own time, or I can yield to speak on it. Okay, you can speak on it. I did go through some of the talking points, but you're welcome, you're recognized to speak on it.
Thank you, Mr. Chairman. Sorry, running between hearings. I'm offering this Ains for the Traumatic Brain Injury Reauthorization Act, which is sponsored by Reps Pasquarello and Bacon, because I know I have so many friends who have suffered from traumatic brain injury. They served in our armed forces, they've served in law enforcement. And now they live with these injuries for many years after their service. To give you an idea, 5 million Americans live with TBI. For military, the estimate is 30% of our service members have experienced some kind of brain injury, and it's similar for law enforcement. And this matters because we know post-traumatic stress disorder and suicide are linked to TBIs. Estimated that 1/3 of veterans have PTSD and almost 1/5 of police officers. They face a lifetime of issues, and it's essential that we fund more research and support for those who are injured. That's why reauthorizing programs to support people with TBI is so important. The research helps everyone. But we have to do more. We have to make sure our best information doesn't sit in an agency in Washington, D.C., and we also have to connect people to that research and continue to update the best practices for preventing, identifying, and treating TBI. So this amendment makes necessary technical changes while ensuring that the existing program is more focused on delivering targeted research and results. It also focuses our government on the issues of chronic brain injury. One of the worst diseases we see in people with TBIs is the terrible brain disorder known as CTE, or chronic traumatic encephalopathy. This disease is basically dementia. The brain damage compounds over time and the brain function degenerates. So it's critical we ensure that our government is caught up on the latest science, and this amendment does just that. And I would ask everyone to support it. Thank you, and I yield back.
The gentleman yields back to me, and I yield back. Any further discussion? Seeing if there's no further discussion on the amendment, the vote occurs on the amendment. All those in favor shall signify by saying aye. Aye. All those opposed, nay. The ayes have it. The amendment is agreed to. Are there any other bipartisan amendments? Any other amendments? Seeing none, the question now occurs on forwarding H.R. 7208 as amended to the full committee. All those in favor shall say aye. Aye. Of those opposed, no. The ayes have it, and the bill is agreed to. The chair calls up H.R. 7406 and asks the clerk to report.
H.R. 7406, a bill to amend the Public Health Service Act to authorize the Secretary of Health and Human Services to carry out a program of research.
Without objection, the first reading of the bill is dispensed with, and the bill will be open for amendment at any point. So ordered. Does anybody seek recognition on the bill? Gentlelady from Washington is recognized. Chair is recognized.
Thank you, Mr. Chairman. I have an amendment in the nature of a substitute at the desk.
The clerk will report the amendment.
Amendment in the nature of a substitute to H.R. 7406, offered by Chair Rogers.
Without objection, the reading of the amendment is dispensed with, and the chair is recognized for 5 minutes in support of her amendment.
I want to speak in support of the amendment and the underlying bill, H.R. 7406, the Deandra Dixon Include Project Act of 2024, which makes technical changes to the legislation. I'm proud to lead this bill, along with Representatives Diana DeGette, Tom Cole, Eleanor Holmes Norton, Rosa DeLauro, and Pete Stauber. This is a deeply personal issue for me. As many of you know, my oldest son Cole was born with an extra 21st chromosome, commonly known as Down syndrome. Just as a side note, Down syndrome is named after Dr. John Landon Down, who identified the common characteristics in the mid-1800s. A few days after Cole was born, I remember the doctor telling my husband and me about the long list of challenges Cole would face. It was so difficult to hear, and we cried tears out of a fear of the unknown. But, you know, they couldn't have been more wrong. Today, Cole is a fun-loving 16-year-old with big dreams. And I can honestly say I've cried the tears of joy for the gift of Cole. And being able to see the world through his eyes has made me a better mom and a better legislator. For decades, Down syndrome research has been dramatically underfunded, despite 1 in every 400 babies in the United States being born with it. As a proud mom of one of those children, I am committed to changing and empowering individuals with Down syndrome to live more full and independent lives. And I am reminded every day the Down syndrome community is full of potential, just waiting to be unleashed. I would also like to emphasize again that this research will not just benefit individuals with Down syndrome, but the millions of people who battle other co-occurring conditions and related diseases like Alzheimer's, cancer, and heart conditions that are common among, but not hardly limited to people with Down syndrome. So while some of us may not know someone with Down syndrome, let alone have a close family member like Cole, I am sure we all know someone who has Alzheimer's or dementia or who has been diagnosed with cancer. Researchers have found unique patterns of cancer in those with Down syndrome. Children with Down syndrome have a 10 to 20-fold higher risk for developing types of leukemia compared to children without Down syndrome, although they do not have an increased risk of developing solid tumors. Individuals with Down syndrome are at an increased risk for Alzheimer's disease, with dementia becoming a leading cause of death for people with Down syndrome. Authorizing the Include project will help ensure the research, activities, and resources to support the Down syndrome community and all those individuals who will benefit from advancements made will continue to flourish. In 1983, the average lifespan of a person with Down syndrome was 25 years. While today it has increased to approximately 60 years, there's more we can do. I remain excited about the endless possibilities that will flow from this project and ask for your support in this important legislation. I yield back.
The chair yields back. Is there any further discussion on the amendment? Seeing none, are there any further amendments? Well, excuse me, seeing no further discussion, the vote occurs on the amendment. And all those in favor shall signify by saying aye. Aye. Those opposed, nay. The ayes have it, and the amendment is agreed to. Are there any further amendments? The question now occurs on forwarding H.R. 7406 as amended to the full committee. All those in favor say aye. Aye. All those opposed, no. The ayes have it, and the bill is agreed to. Without objection, the staff is authorized to make technical and conforming changes to the legislation approved by the subcommittee today. So ordered. Without objection, the subcommittee stands adjourned.